even learn many things from me, Swamiji. तो छोटी सी इंट्रोडक्शन के बाद आप अगली सेशन आपको सौंप रहे हैं, प्लीज कैरी फॉरवर्ड द सेशन। थैंक यू वेरी मच। आपका स्वागत है स्वामी जी, शुरू करें।
हाँ, स्वयं महाराज प्रणाम। वेलकम टू तेलंगाना, वेलकम टू यूनिवर्सिटी। आप ऑडिबल है ना?
आइए, मेरी आवाज
1 सेकंड स्वयं महाराज। हाँ, आपका आवाज आ रही है, 1 मिनट। I want to add some more things about Pujya Swami Yagyadev ji. The great thing is who is always associated with Pujya Swami Ramdev Baba, and also the uniqueness is Swamiji is continuously working on Yagna and Yagna therapy, especially involved in the Patanjali Research Center, Haridwar, along with various scientists, and he conducted number of programs as well as visited entire the country, and he tried to spread the Yagna as a therapeutic solution for the common people. It's a beautiful thing. I think today is the right day and right person with us. Whatever we are perceiving nowadays, where there is a full of environmental problem, full of pollution, full of various bacterial pollution. So people are suffering with various health disorders due to this environmental pollution and other things. So Swamiji is the unique person who done number of research activities and even published in the international journals and showed a solution for a present day problem, that is environmental crisis and various health problems. So I'm so happy, glad to invite Pujya Swami Yagyadev ji in this program. I'm requesting Swami Yagyadev ji Maharaj, kindly you please give a explore, because in the Telangana, Usmania University is one of the biggest university. In that also University College of Education and EMRC and ICSSR, SRC, School of Education, all these things are highly, intellectual activities are continuously going. Pujya Swamiji Maharaj, how the Yagna is solution for these environmental crisis and health problems, how it can be accepted as Yagna therapy, you please explain in your own words. Swamiji Maharaj, आपने जो मेहनत किया, जो लोगों तक पहुंचाने की कोशिश किया, कृपया आज की ये जो गणे माने इंटेलेक्चुअल कम्युनिटी के पास ये यज्ञ कैसा एक बहुत बड़ा समाधान होंगे, आज की जो एनवायरमेंटल क्राइसिस है और हेल्थ प्रॉब्लम्स है, इसके लिए कैसा एक समाधान बनेंगे, आप हमें दे। आपको फुल टाइम है till 10:45 तक। So over to Pujya Swami Yagyadev ji Maharaj.
आप सभी योगी साधक भाई बहनों को मैं इस विशेष अवसर पर प्रणाम करता हूं, नमन करता हूं। हमारे सारे शिक्षण संस्थान के मुख्य पदाधिकारी और अध्यापक गण से लेकर के विद्यार्थी गण और संपूर्ण विद्या के क्षेत्र में सेवा दे रहे सारे कार्यकर्ता भाई बहनों को मैं प्रणाम करता हूं, नमन करता हूं, वंदन करता हूं। और विशेष हमारे आदरणीय भ्राता किशोर भाई जी, जो इस विभिन्न समाज सेवा के, राष्ट्र उत्थान के, मानवता के निर्माण के इस कार्यों में अपनी अहर्निश सहभागिता भूमिका निभाते हुए इस कार्य को आगे बढ़ा रहे हैं। आदरणीय भ्राता किशोर भाई जी से भी मैं प्रणाम करता हूं, नमन करता हूं। और आज हम विशेष रूप से सब लोग मिल करके पूरे श्रद्धा भाव भक्ति से युक्त होकर के हमारी जो प्राचीन विद्याएं हैं, योग, यज्ञ, आयुर्वेद, यह विद्या केवल मात्र एक पैसा देने के लिए, मानी एक जीवन शैली को देने वाली होती, जीवन को देने वाली होती, इसलिए इसको जीवन विद्या कहा गया। तो आज हम इस जीवन विद्या में यज्ञ पूर्वक योगाभ्यास, अभी 21 जून आ रहा है, यह भारत के लिए एक बहुत बड़ा पर्व बन चुका है कि आज देश ही नहीं पूरी दुनिया भारतीय इन जीवन विद्याओं को आज आत्मसात कर रही है, अपने जीवन में उतारी। ये भी अपने आप में एक बहुत बड़ी बात है। तो आइए इस गौरव को अपने भीतर समेटते हुए आज के इस सत्र की शुरुआत हम 5 मिनट के छोटे से हवन पूर्वक हम करेंगे। तो आप जहां पर भी बैठे, वहां बैठे हुए मेरे साथ इन्वॉल्व होकर के मंत्र का पाठ करते हुए सीधा मेरे दंड रखते हुए आप बैठेंगे, तो निश्चित रूप से आप जहां पर भी अपने घर पे, अपने स्थान पे, अपने संस्थान में जहां पर भी आपको भी लाभ होगा, तो सभी लोग सीधे बैठ करके हम यज्ञ पूर्वक आज के इस सत्र का प्रारंभ करते हैं। यह अग्नि की पूजा अपने आप में एक विशेष है और यह एक विज्ञान भी है। तो आइए सभी लोग सीधे बैठ करके हाथ जोड़ करके ओम भूर्भुवः स्वः ओम भूर्भुवः स्वर्योरिव भूम्ना पृथिवीव वरिम्ना तस्या आस्ते पृथिवी देव यजनी पृष्ठे अग्निमन्नादमन्नाद्यायाददे ओम उद्बुद्ध्य स्वाग्ने प्रतिजागृहि त्वमिष्टा पूर्ते सगं सृजेथामयं च अस्मिन् सदस्थे अद्युत्तरस्मिन् विश्वे देवा यजमानश्च सीदता। अग्नि प्रदीप्त करके आचमन अंग स्पर्श पवित्रीकरण शुद्धिकरण की प्रक्रिया। ओम अमृतोपस्तरणमसि स्वाहा ओम अमृतापिधानमसि स्वाहा ओम सत्यम यशः श्रीर्मयि श्री श्रयतां स्वाहा। आचमन के बाद अंग स्पर्श। ओम वांग आस्यस्तु ओम नसोर्मे प्राणोस्तु ओम अक्ष्णोर्मे चक्षुरस्तु ओम कर्णयोर्मे श्रोत्रमस्तु ओम बाहोर्मे बलमस्तु ओम उर्वोर्म ओजोस्तु ओम अरिष्टानि मेंगानि तनुस्तन्वा मे सहसन्तु। जल प्रोक्षण। ओम अदितेनुमन्यस्व ओम अनुमतेनुमन्यस्व ओम सरस्वत्येनुमन्यस्व ओम देव सविता प्रसुव यज्ञं प्रसुव यज्ञपतिं भगाय दिव्यो गंधर्वः केतपुः केतं नः पुनातु वाचस्पतिर्वाचन्नः स्वदतु। आचमन अंग स्पर्श या पवित्रीकरण शुद्धिकरण की प्रक्रिया के बाद मूल आहुतियां। ओम अग्नये स्वाहा इदम अग्नये इदन्न मम ओम सोमाय स्वाहा इदम सोमाय इदन्न मम ओम प्रजापतये स्वाहा इदं प्रजापतये इदन्न मम ओम इंद्राय स्वाहा इदम इंद्राय इदन्न मम ओम सूर्यो ज्योतिर्ज्योतिः सूर्य स्वाहा ओम सूर्यो वर्चो ज्योतिर्वर्चः स्वाहा ओम ज्योतिः सूर्यो ज्योति स्वाहा ओम सजुर्देवेन सवित्रा सजुर्सेन्द्रवत्याजुषाणो अग्निर्वेतु स्वाहा ओम भूरग्नये प्राणाय स्वाहा इदमग्नये प्राणाय इदन्न मम ओम भुवर्वायवे पानाय स्वाहा इदं वायवे पानाय इदन्न मम ओम स्वरादित्याय व्यानाय स्वाहा इदमादित्याय व्यानाय इदन्न मम ओम भूर्भुवस्वरग्निवायुवादितेभ्यः प्राणापान व्यानेभ्यः स्वाहा इदमग्निवायुवादितेभ्यः प्राणापान व्यानेभ्यः इदन्न मम ओम आपो ज्योतिरसोमृतं ब्रह्म भूर्भुवस्वरों स्वाहा ओम या मेधां देवगणः पितरश्च उपासते तया मामस्य मेधयाग्ने मेधाविनं कुरु स्वाहा ओम विश्वानि देव सवितर्दुरितानि परासुव यद्भद्रं तन्न आसुव स्वाहा ओम अग्ने नय सुपथाराये अस्मान् विश्वानि देव वयुनानि विद्वान् युयोध्यस्मज्जुहुराणमेनो भूयिष्ठान्तेन मुक्तिं विधेम स्वाहा ओम भूर्भुवस्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो नः प्रचोदयात् स्वाहा ओम त्र्यंबकं यजामहे सुगंधिं पुष्टिवर्धनम् उर्वारुकमिव बन्धनान् मृत्योर्मुक्षीयमामृतात् स्वाहा। ओम सर्वं वै पूर्णत्वं स्वाहा। ओम सर्वं वै पूर्णत्वं स्वाहा। ओम सर्वं वै पूर्णत्वं स्वाहा। ओम सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामयाः, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखभाग् भवेत्। ओम शांति 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 ओम। इस प्रकार यह 5 मिनट से 7 मिनट का समय लगता है। 5 से 7 मिनट के अंदर हम एक छोटा सा हवन, इसको देव यज्ञ भी कहते हैं, चिकित्सा यज्ञ भी कहते हैं, और इतना सा हवन करने पर हमारा जो पूरा एटमॉस्फेयर, वायुमंडल, पंचतत्व पोषित, संवर्धित, संतुलित होते हैं, हमें आरोग्य देते हैं। हम जब योगाभ्यास करते हैं, योगासन करते हैं, ध्यान साधना उपासना करते हैं, आप सभी लोग जानते हैं कि जब हम इस प्रकार के विशिष्ट कार्यों का निष्पादन करते हैं तो वहां पर किस स्थान पे योगाभ्यास किया जाए, कैसा वायुमंडल हो, कैसा स्थान हो, उसके विषय में विशेष रूप से हमारे प्राचीन ग्रंथों में, प्राचीन शास्त्रों में विधान आता है कि जहां पर नदी, झरने, तालाब, समुद्र के तट, पहाड़ी क्षेत्र या बागवान आदि हो, ऐसे स्थानों पर यदि हम योग करते हैं तो उसका हमें विशेष रूप से लाभ प्राप्त होता है। आज देखिए हम जिस जीवन शैली को जी रहे हैं, हम शहरों के अंदर रह रहे हैं और भी जगह पर हमारा पूरा वायुमंडल एक अलग तरीके से, एक अलग रूप में आज निर्मित हो चुका है। कहने का अभिप्राय है कि आज वर्तमान में हम ऐसे स्थानों पर योग करना चाहें प्रतिदिन, वह संभव नहीं है। लेकिन यदि आप जो योगाभ्यास आधा घंटा करते हैं, 1 घंटा करते हैं, 2 घंटा करते हैं, चाहे आप प्राणायाम कर रहे हैं, मेडिटेशन कर रहे हैं या योगासन आदि कर रहे हैं, आप यदि 5 से 7 मिनट ये यज्ञ कर दिया और ये यज्ञ करने के उपरांत यदि उस स्थान पे योगाभ्यास करते हैं तो उसकी वो विशेषता होती है कि जिस स्थान पर योग करने से जो कहा जाता है कि वहां के वायुमंडल के अंदर एक विशेषता होती है, इसलिए ऐसा स्थान कहा जाता है। और आज जो रिसर्च हुई, वो रिसर्च अनुसंधान भी बताते हैं जहां नदी, झरने, तालाब, पहाड़ी क्षेत्र, समुद्र के तट, ऐसे जो स्थान होते हैं वहां के वायुमंडल के अंदर प्रति सेंटीमीटर 200 से 400 ऋण आवेशित कण होते हैं। अथाह वायु के समुद्र के अंदर हम रहते हैं। इस वायु के अंदर 2 प्रकार के पार्टिकल पाए जाते हैं, एक धन आवेशित कण होते हैं और एक ऋण आवेशित कण होता है। उसमें यह यज्ञ जिस स्थान पे प्रतिदिन ऐसे 5-7 मिनट हमने किया कि 5 मिनट भी नहीं लगा, शायद बहुत ज्यादा तो 5 मिनट, बहुत आराम से करेंगे तो 7 मिनट, 5 से 7 मिनट जो यज्ञ करते हैं उतनी देर में वहां के एटमॉस्फेयर में, वहां के वायुमंडल के अंदर प्रति सेंटीमीटर एयर के अंदर 200 से 400 ऋण आवेशित कण पाए जाते हैं। इतनी बड़ी संख्या होती है। जो घना जंगल हो वहां जो वायुमंडल हो, ऐसा वायुमंडल हम अपने हाथों से अपने घर के अंदर निर्मित कर सकते हैं और अपने पूरे परिवार को वो वायुमंडल दे सकते हैं। उसमें जब हम योगाभ्यास करेंगे, उसमें जब हम प्राणायाम करेंगे, उसमें जब हम आसन आदि करेंगे तो उसका हमें विशेष रूप से लाभ होने वाला है। और ये जो ऋण आवेशित कण होते हैं उसके 2 लाभ विशेष होता है। एक, शरीर के अंदर ब्लड सीरोटोनिन की मात्रा को बढ़ाता है, मन को प्रसन्न करता है, मन को आह्लादित करता है, हमें अच्छा लगता है, स्फूर्ति आती है, शरीर में एनर्जी आती है, हमें कार्य करने में एक प्रकार से तेजी आने लगती है, एक स्फूर्ति आने लगती है। ये बहुत बड़ी उपलब्धि है। आज कार्यों में सुस्ती और इस प्रकार के प्रॉब्लम्स कितनी बड़ी मात्रा में बढ़ रही है, तो इतना छोटा सा हम हवन कर ले तो इस प्रॉब्लम से बच सकते हैं। और दूसरा, निरंतर उस ऋण आवेशित वायु में रहने से हमारी बॉडी अल्कलाइन हो जाती है, क्षारीय हो जाती है। आप सब जानते हैं क्षारीय शरीर होने पर, क्षारीय बॉडी होने पर कोई रोग होता नहीं है। और जब अम्लीय एसिडिक बॉडी हो जाती है तो उसमें अलग अलग प्रकार के अनेक रोग होते हैं। तो जिस स्थान पे यज्ञ होता है और उस वायुमंडल के अंदर हम रहते हैं तो हम बीमारियों से भी बचेंगे, बॉडी अल्कलाइन रहने के कारण। तो ये 2 लाभ पहले विशेष रूप से हमें प्राप्त होंगे। तीसरा एक महत्वपूर्ण और विशेष लाभ आरोग्य की दृष्टि से हम देखें, आज आप सब जानते हैं वो अल्कलाइन वाटर। आज जो लोग बीमार होते हैं तो उनको विशेष रूप से अल्कलाइन वाटर पीने के लिए सजेस्ट किया जाता है हॉस्पिटलों के अंदर। 80 रुपए से लेकर के 100 रुपए का 1 लीटर पानी आता है और उसकी मशीन लगाते हैं तो 2.5-3.5 लाख रुपए की एक मशीन लगती है। जबकि आप इस प्रकार से छोटा सा हवन करते हैं और बाद में जो बची हुई जो एश, राख, भस्म, भभूत होती है उसको थोड़ा सा खरल करके पीस करके रख लेते हैं। और आपको जानकर के आश्चर्य भी होगा और गर्व भी होगा कि हम जो पानी पीते हैं उसमें 1 से 2 चुटकी वो भस्म डाल दो, जो 3.5 लाख रुपए की अल्कलाइन करने की मशीन पानी जो अल्कलाइन करके देती हैं, या जो 100 रुपए का लीटर आपको पानी मिलता है, आप इस भस्म को 2 ग्राम डालिए, आपको वो पानी अल्कलाइन मिल जाएगा। इतना छोटा सा हवन के लिए उसकी भस्म का भी यदि आप प्रयोग, तो आप अल्कलाइन वाटर का प्रयोग करके भी अपने आरोग्य को, अपने स्वास्थ्य को उत्तम बना सकते। ये भी अपने आप में बहुत बड़ी चीज है। तो हम क्या करते हैं कि एक छोटे से कपड़े के अंदर भस्म डाल करके उसकी पोटली बांध देते हैं और उसको जो रात को जो पानी दिन भर पीना होता है उस पात्र के अंदर डाल देते हैं और थोड़ी देर रहने देते हैं और उसके बाद उस पोटली को निकाल करके 2-4 बार निचोड़ कर डालते हैं। अब ये जो पानी है वो पूरा पानी अल्कलाइन हो जाता है, प्लस उसके साथ साथ उसके अंदर कैल्शियम, जो घुटने या हड्डियों आदि की कमजोरी आती है तो उसको भी दूर करने में काम आता है। कैल्शियम, आयरन, रक्त अल्पता हो जाती है, अशक्ति हो जाती है, वजन नहीं बढ़ता है या शरीर में ताकत नहीं आती है, आयरन की हमें आवश्यकता, तो आयरन, कैल्शियम, आयरन, जिंक, पोटेशियम, मैग्नीशियम, एक खनिज भी उस पानी में हमें मिल जाता है। ये बहुत बड़ी चीज है, सामान्य रूप से हमें बहुत सामान्य दिखता है, लेकिन ये बहुत सारी चीजें। और उस भस्म का सेवन करना, इस पानी का पीना, तो उससे हमारे शरीर के अंदर ब्लड ऑक्सीजन की मात्रा भी बढ़ती है, एनर्जी का लेवल बढ़ता है और भी बहुत सारी चीजें जिनको बहुत ज्यादा एसिडिटी है, पित्त है, बालों का झड़ना, बालों का समय में सफेद होना और भी अलग अलग प्रकार की ऐसी जो डेफिशिएंसी और अलग अलग प्रकार की ऐसी समस्याएं होती हैं, उन समस्याओं से भी ये यज्ञ की भस्म बचाने वाली होती है। मानी जिस चीज को हवन करके जो लाभ हमने वायुमंडल में ले लिया वो तो लिया, लेकिन ये जो फेंकने वाली भस्म होती है उसका भी यदि हम प्रयोग कर ले तो उससे भी इतने सारे लाभ हमें प्राप्त होते हैं। तो यज्ञ की भस्म का हम प्रयोग ले सकते हैं। उसके साथ साथ आज अभी ताजा हुई कुछ रिसर्चों के बारे में मैं बताऊं तो अभी सेंट्रल कंट्रोल पोल्यूशन बोर्ड दिल्ली CPCB और जयपुर यूनिवर्सिटी राजस्थान की रिपोर्ट यह बताती है कि हवन करने पर, यजन करने पर, अग्निहोत्र करने पर जो धूम्र उठता है उस धूम्र के अंदर विभिन्न प्रकार के फाइटोकेमिकल्स मॉलिक्यूल्स जब वायु के अंदर आते हैं, ऑर्गेनिक मॉलिक्यूल्स, तो उसके वायु के अंदर आने पर 2 प्रकार के रेडिएशन से जिससे हम जूझते हैं, एक है इलेक्ट्रोमैग्नेटिक रेडिएशन और दूसरा है एटॉमिक रेडिएशन। ये दोनों ही प्रकार के रेडिएशन की रेंज को भी वो तोड़ देता है। ये भी कितनी बड़ी बात है कि हम अपने घर के अंदर इतना छोटा सा हवन कर तो हम पूरे परिवार को रेडिएशन के दुष्प्रभाव से भी हम बचा सकते हैं। उसके साथ साथ आज एक बहुत बड़ी समस्या देश ही नहीं पूरी दुनिया की है, कम्युनिकेबल डिजीज, बैक्टीरिया, वायरस और फंगस जनित बीमारियां देश ही नहीं पूरी दुनिया में भारी मात्रा में बढ़ रही है। और दुनिया की बड़ी बड़ी संस्थानों की रिसर्च रिपोर्टें बताती हैं कि आज सबसे तेजी से और बड़ी मात्रा में फैलने के साथ साथ 2.25 करोड़ लोगों की जान ले रहे हैं बैक्टीरिया, वायरस, फंगस जनित बीमारियां। और आज वर्तमान में जो अनुसंधान हुए कि यज्ञ करते हैं, हवन करते हैं, अग्निहोत्र करते हैं और यज्ञ, हवन, अग्निहोत्र करने पर जो उत्पन्न धूम्र है उस धूम्र को जब एनालाइज किया गया, GCMS केमिस्ट्री लैब की है, एक एडवांस टेक्नोलॉजी होती है, गैस क्रोमेटोग्राफी, मास स्पेक्ट्रोस्कोपी, जो चीजों को माइक्रो लेवल पर एनालाइज करके देती है कि कौन कौन सी चीजें और कितनी मात्रा में है। उसके अंदर ये यज्ञ के धूम्र को जब एनालाइज किया गया तो उसके अंदर भारी मात्रा में माइक्रोबायल एक्टिविटी देने वाले कंपोनेंट्स, मॉलिक्यूल्स पाए गए। उसके बाद माइक्रोबायोलॉजी लैब में जिन बैक्टीरिया, वायरस, फंगस आदि से हम प्रभावित होते हैं, रुग्ण होते हैं, बीमार होते हैं, और जो आज देश और दुनिया की बड़ी बड़ी रिसर्च इंस्टीट्यूट और हेल्थ सेक्टर की संस्थाएं जो आंकड़े बताती हैं कि आज अलग अलग रूपों में जो कम्युनिकेबल डिजीज बढ़ रही है उसमें कई सारे कारण हैं। उसमें से अभी एक रिसर्च हुई, आपको भी जान करके बड़ा आश्चर्य होगा कि कई सारे अलग अलग प्रकार के ऑपरेशन करने वाले डॉक्टर्स, कुछ OPD चलाने वाले डॉक्टर्स, कुछ ऑफिस चलाने वाले ऑफिसर, कुछ ड्राइवर, कुछ दुकानदार, ऐसे अलग अलग प्रकार के लोगों को लिए गए और उनके फोन को स्वाइप किया गया और उसको माइक्रोबायोलॉजी लैब के अंदर वो सारे सैंपलों को टेस्ट किया गया। आपको जानकर के आश्चर्य होगा कि जितने बैक्टीरिया, वायरस, फंगस जानलेवा हमारे घर के टॉयलेट सीट के ऊपर भी नहीं होते हैं, उससे भी ज्यादा बैक्टीरिया, वायरस और फंगस हमारे मोबाइल और मोबाइल के कवरों के ऊपर पाए गए। मानिए हम चलते फिरते, खाते पीते, उठते बैठते जिस मोबाइल को अपने हाथ में रख रहे हैं, ये कम्युनिकेबल डिजीज को फैलाने का सबसे बड़ा साधन है। और ऐसे ना जाने कितने सारे अलग अलग उपकरण, अलग अलग चीजें हैं जिनको हम प्रयोग करते हैं, जो इस बैक्टीरिया, वायरस, फंगस को बढ़ाते हैं और जिसके कारण बीमारियां होती हैं और जिसके कारण से बहुत भारी मात्रा में हानि भी होती है। तो उसमें जो रिसर्च की गई, जो अनुसंधान किए गए, उन बैक्टीरिया, वायरस, फंगस आदि को लिया गया और उसमें जब परीक्षण किए गए तो आपको जानकर के आश्चर्य हो गए, यज्ञ का धूम्र देने पर केवल मात्र एक बार 5-7 मिनट की यज्ञ से 65% से 96% बैक्टीरिया, वायरस, फंगस आदि उस कमरों से खत्म हो गए। कितनी बड़ी चीज है। और ये सारे रिसर्च डाटा को हमने अलग अलग तरीके से बार बार प्रयोग करने के उपरांत हमने जब इंटरनेशनल जर्नल के अंदर पब्लिश करने के लिए भेजा, तो आज से कुछ महीना पहले वो रिसर्च पेपर भी पब्लिश हो चुके हैं कि यदि हम भारतीय इस विद्या को, जो औषधियों को अग्नि में जलाना, अंगारों के ऊपर डाल करके उसकी धुनी करने वाली इस विद्या को यदि लोगों को थोड़ी सी मात्रा में हम सिखा दें, तो हम 2.25 करोड़ लोगों की जान बचा सकते हैं और हजारों करोड़ रुपए कम्युनिकेबल डिजीज होने पर जो खर्च होते हैं उसको हम बचा सकते हैं। ये इतनी बड़ी विद्या है। कहने का अभिप्राय है ये जो यज्ञ हमने अभी 5 से 7 मिनट में कर लिया, ये छोटी चीज नहीं है। यदि इतना कर ले तो हम पूरे परिवार को कम्युनिकेबल डिजीज से बचा सकते हैं, पूरे परिवार को रेडिएशन से बचा सकते हैं, एटॉमिक रेडिएशन और इलेक्ट्रोमैग्नेटिक रेडिएशन। और उसके साथ साथ जो मैंने बताया कि वायु के अंदर प्रति सेंटीमीटर एयर के अंदर 200 से 400 ऋण आवेशित कणों को बढ़ा देता है और उसमें रहने से बॉडी का अल्काइन होना, ब्लड सेरोटोनिन का बढ़ना, स्फूर्ति, एनर्जी, शक्ति हमारे शरीर के अंदर आती है, वो भी लाभ होता है। उसके साथ साथ आज नासा के अंतरिक्ष वैज्ञानिक डॉक्टर ओम प्रकाश पांडे और सीपीसीबी, सेंट्रल कंट्रोल पोल्यूशन बोर्ड दिल्ली में डॉक्टर आदरणीय ममता सक्सेना जी, उन्होंने कई सारी अलग अलग रिसर्च की। इससे अतिरिक्त और भी बहुत सारी संस्थानों की रिसर्च रिपोर्टें बताती कि हवन करने पर एथिलीन ऑक्साइड, प्रोपेलिन ऑक्साइड से लेकर के अलग अलग प्रकार की गैसों का निर्माण होता है। वो जब वायु के अंदर आती हैं तो वायु में आने पर, वायु में पहले से बहुत सारी गैसें मौजूद है, दोनों जब आपस में मिलती हैं तो एक फोटोकेमिकल प्रोसेस चलता है। एक हम सब लोग जानते हैं फोटोसिंथेसिस प्रक्रिया। इसी प्रकार ये फोटोकेमिकल प्रोसेस होते हैं जो आपस में मिल करके एक विशेष रूप से ये जो अलग अलग प्रकार की जो गैसें हैं उसके मॉलिक्यूल्स, कंपोनेंट्स टूटते हैं, बनते हैं, टूटते हैं, बनते हैं, जिसके परिणाम स्वरूप पाया गया कि जो हानिकारक गैसें हम कहते हैं, जिसको पोल्यूटेंट गैसें कहते हैं, जिसको WHO के अनुसंधान के आधार पर कहा गया कि जिस प्रदूषित वायु के अंदर रहने पर पूरी दुनिया में 70 लाख से अधिक लोगों की जान चली जाती है, वो पोल्यूटेंट गैसें यज्ञ करने पर फोटोकेमिकल प्रोसेस के परिणाम स्वरूप दूर होती है, नष्ट होती है, न्यूट्रलाइज हो जाती है। ये भी एक अपने आप में बहुत बड़ी चीज है। इंडोर एयर पोल्यूशन और आउटडोर एयर पोल्यूशन, दोनों ही प्रकार के पोल्यूशन से हम बच सकते हैं। मुंबई में भी हमने 2 अलग अलग परीक्षणों की रिपोर्टें, सेंट्रल वहां की जो पोल्यूशन गवर्नमेंट बोर्ड है उसके माध्यम से 2 बड़े प्रयोग किए गए, उसमें भी हानिकारक गैसों से बचाव के विषय में विशेष रूप से बताया। और सबसे बड़ी चीज होती है सेंट्रल कंट्रोल पोल्यूशन बोर्ड, और उसके माध्यम से उनकी जो रिपोर्ट आई है अपने आप में एक बहुत बड़ी ताकतवर रिपोर्ट होती है। तो कहने का अभिप्राय है कि वायु प्रदूषण से भी हमें बचा लेता है। और उसके साथ साथ देखिए आयुर्वेद के अंदर या हमारे प्राचीन शास्त्रों में देखिए तो यज्ञ को एक ट्रीटमेंट के रूप में, एक चिकित्सा के रूप में भी देखा गया कि यह यज्ञ जो होता है उसके अंदर एक केमिस्ट्री है पूरा। इसके अंदर एक द्रव्य डालोगे तो इसका अलग अलग टेम्परेचर के ऊपर उसके दहन पर वो अपने एरोमेटिक्स, ऑयल्स और मेडिसिनल कंपोनेंट्स को वायु के अंदर छोड़ता है। इसलिए अलग अलग जड़ी बूटियां जब हम जला, जैसे आप गुगुल है, चंदन है, उसको जलाते हैं तो उसकी जो एक सुरभि होती है, उसकी जो एक सुगंधी होती है, तो उसके अंदर गुगोस्टेरॉल है, परफ्राल है, ऐसे कंपोनेंट होते हैं जो सोमनस्यकारी होते हैं, मन को प्रसन्न करने वाले होते हैं, मन को आह्लादित करने वाले होते हैं, स्ट्रेस, तनाव, डिप्रेशन को दूर करने वाले होते हैं, गुड हार्मोन्स को बनाने वाले होते हैं, स्ट्रेस हार्मोन्स को दूर करने वाले होते हैं। आज स्ट्रेस, तनाव, डिप्रेशन दुनिया की सबसे बड़ी बीमारी भी है, समस्या भी है और बड़ी बड़ी बीमारियों का कारण भी है। जबकि हम ये छोटा सा यज्ञ करते हैं, उससे जो सुगंधि प्राप्त होती है वो घर के अंदर हम फैलाते, तो घर के सभी लोगों को ये प्राप्त होती है। उसको सूंघने पर पिट्यूटरी ग्लैंड आदि प्रभावित होते, गुड हार्मोन्स बनते, स्ट्रेस हार्मोन डाउन होते, जिसके कारण से हम एक बड़ी बीमारी जिसको कहा जाता है उससे भी हम बच जाते हैं। ये भी अपने आप में एक बहुत बड़ी चीज है। उसके साथ साथ जब हम अलग अलग द्रव्यों को डालते हैं, और हमने यहाँ पर PRI पतंजलि रिसर्च इंस्टीट्यूट में जो अनुसंधान शोध किए परम पूज्य श्रद्धेय स्वामी जी महाराज और परम पूज्य श्रद्धेय आचार्य श्री महाराज के मार्गदर्शन निर्देशन में, आपको जानकर के आश्चर्य होगा कि अलग अलग जड़ी बूटियों को जलाने पर, अंगारों के ऊपर डालने पर जो उठने वाला धूम्र होता है, उस धूम्र को जब एनालाइज किया गया तो उसके अंदर पोल्यूशन नहीं अपितु मेडिसिनल कंपोनेंट्स पाए गए अलग अलग। जब हम बॉडी को डिटॉक्सिक करने के लिए जो दवाइयां खाते हैं, एंटीऑक्सीडेंट कंपोनेंट, वो भी इसके अंदर पाए गए गैस फॉर्म में, अवेलेबल रूप में। जब सूजन, दर्द, इंफेक्शन आदि होते हैं तो उस समय हम एंटी इंफ्लेमेटरी कंपोनेंट लेते हैं, वो भी इसके अंदर पाए गए। कम्युनिकेबल डिजीज होने पर जो हम दवाइयां खाते हैं, माइक्रोबायल एक्टिविटी देने वाले कंपोनेंट्स, वो भी इसके अंदर पाए गए। कैंसर को ना होने देना या होने पर जो इलाज के लिए हम अलग अलग कंपोनेंट्स का प्रयोग करते हैं, एंटी माइक्रोबायल कंपोनेंट्स, वो भी इसके अंदर पाए गए। एंटी कोलेस्ट्रॉलिक कंपोनेंट्स इसके अंदर पाए गए। इस प्रकार से अलग अलग, यहां तक कि एंटी ब्यूटाजेनिन, हमारे जीन्स में आने वाले बदलावों को रोकने वाले भी मॉलिक्यूल्स, कंपोनेंट्स यज्ञ के धूम्र के अंदर पाए गए, अवेलेबल फॉर्म में, परमिसिबल लिमिट के अंदर। ये अपने आप में एक बहुत बड़ी चीज सामने आई, और उन अनुसंधानों के आधार पे आज आपको आश्चर्य होगा, वर्ल्ड में, दुनिया में पहली बार एविडेंस बेस्ड मेडिसिन के तौर पे आज ये अलग अलग प्रकार की 11 प्रकार की मेडिसिन, 11 प्रकार की औषधियां निर्माण किया गया है। और आज भारत के अंदर 3000 से ज्यादा हॉस्पिटल, 3000 से ज्यादा हॉस्पिटल के अंदर हम ऑलरेडी प्रैक्टिस में प्रयोग कर रहे हैं। जितने भी हमारे वेलनेस सेंटर हैं उसमें हम आवश्यक रूप में लोगों को विशेष रूप से यज्ञ चिकित्सा देकर के उसका उपचार करने का काम करें, क्योंकि जो सुगंधी होती है, सुरभि होती है, उससे गुड हार्मोन्स बनते हैं, उससे स्ट्रेस, तनाव, डिप्रेशन आदि दूर होता है, तो उससे भी हमारी चिकित्सा होती है। ऋण आवश्यक कण बढ़ते हैं, ब्लड सीरोटोनिन बढ़ता है, स्फूर्ति एनर्जी आती है, उससे भी हमारी चिकित्सा होती है। उसके अंदर निरंतर रहने पर बॉडी अल्कलाइन होती है, उससे भी हमारी चिकित्सा होती है। जो भस्म वाला पानी है उसको पीने पर ब्लड ऑक्सीजन बढ़ता है, पूरी बॉडी अल्कलाइन होती है, उसके माध्यम से भी हमारी चिकित्सा होती है। उसके साथ साथ जो वो मेडिसिनल कंपोनेंट्स होते हैं, वो जब वायु के अंदर आते हैं तो वो वायु, अब हम नॉर्मल एयर के अंदर सांस लेते हैं, आप देखिए बहुत बड़ी चीज है, हमारा ध्यान ही इसकी ओर नहीं जाता है। हम जिस जीवन को जी रहे हैं उस जीवन को जीने के लिए हमें शक्ति की आवश्यकता होती है, और उस शक्ति को प्राप्त करने के लिए हम क्या करते हैं, आहार लेते हैं। वो आहार हम 3 रूपों में लेते हैं, ठोस, द्रव और गैस। एक बहुत महत्वपूर्ण बात मैं बता रहा हूं, ठोस, द्रव और गैस, 3 रूपों में हम आहार लेते हैं। ठोस रूप में रोटी, दाल, चावल, सब्जी आदि, द्रव रूप में पानी, दूध, जूस आदि, और गैस फॉर्म में वायु। ये 3 रूपों में हम आहार लेते हैं। आप 24 घंटे में देखिए 3 में से सबसे ज्यादा आहार हम कौन सा लेते हैं? भोजन कितनी बार लेते हैं? 3 बार, 4 बार, 2 बार। लेकिन द्रव रूप आहार, पानी, दूध, जूस आदि 10 बार, 15 बार। ठंडी है तो थोड़ा कम, गर्मी है तो थोड़ा ज्यादा। लेकिन गैस रूप आहार, वायु, एनी टाइम 24 घंटे हम ले रहे हैं, खाते पीते, उठते बैठते, चलते पीते, यहां तक कि रात को हम सो जाए तब भी हर 1 सेकेंड कोई आहार ले रहे हैं तो वायु रूप आहार ले रहे हैं। अब इंपोर्टेंस देखिए इन तीनों आहार में। हम रोटी, दाल, चावल आदि ठोस रूप आहार लेना छोड़ दें तब भी हम 2 से 3 सप्ताह जीवित रह सकते हैं, 2 से 3 महीना जीवित रह सकते हैं। हम द्रव रूप आहार, पानी, दूध, जूस आदि लेना छोड़ दे तब भी हम 2 से 3 सप्ताह जीवित रह सकते हैं। लेकिन गैस रूप आहार, वायु लेना छोड़ दे तो 2 से 3 मिनट भी जिंदा रहना संभव नहीं। मानी सबसे ज्यादा के साथ साथ सबसे इंपॉर्टेंट, महत्वपूर्ण आहार जिसके बिना 2 मिनट भी हमारा जीवन संभव नहीं है, ऐसा कोई हमारा आहार है तो क्या है? वायु रूप आहार। और उस वायु को मेडिकेटेड बनाना, सुगंधित बनाना, उसको विजातीय तत्वों से निवृत्त करके एक जीवनीय शक्ति से युक्त करने का काम ये यज्ञ के माध्यम से होता है। जहां पेशेंट रहते हैं, जहां व्यक्ति रहते हैं, वहां पर ये यज्ञ कर लिया तो 24 घंटा जो श्वास ले रहा है वो सुगंधित एयर के साथ साथ मेडिकेटेड एयर है, जो मैंने आपको एंटी इन्फ्लामेटरी, एंटी माइक्रोबायल से लेकर के अलग अलग मेडिसिनल कंपोनेंट्स बताए, वो कंपोनेंट से युक्त एयर में वो श्वास लेता है। वो हर श्वास के साथ वो मॉलिक्यूल्स कंपोनेंट्स हमारे लंग तक, लंग के माध्यम से ब्लड तक, ब्लड के माध्यम से हमारे शरीर की एक एक कोशिका पर जा करके उसको ट्रीट करने का काम करता है। और आयुर्वेद के अंदर इसको देव व्यापार से चिकित्सा के अंदर विशेष रूप से गिना गया और वहां पर बताया यया प्रयुक्त्या चेष्टा राज यक्ष्मा पुराजिता ताम वेद विहिताम आरोग्यार्थी प्रयोजक। जब बीमारी की अवस्था बढ़ चुकी है, बिगड़ चुकी है, अलग अलग प्रकार की दवाइयां लेने पर भी जो रोग ठीक नहीं होता है, उस बीमारी को जीतने के लिए आरोग्य चाहने वाला व्यक्ति वेद विहित यज्ञ का अनुष्ठान करके उस बीमारी को जीते। और अथर्ववेद में भी यदि क्षितायुर यदि वा परे तो यदि मृत्यु और अंतिकम नित्य तमाहरामि निर्तेरस पार्श्वमेनम सत सारदाय बताए। व्यक्ति की आयु क्षीण हो चुकी है, उनके प्राण क्षीण हो चुके, उनकी धातु ये क्षीण हो चुकी है, अब लंबा जीवन नहीं दिख रहा है, मौत सामने खड़ी हुई दिख रही है, तमाहरामि निर्तेरस पार्श्वमेनम सत सारदाय, उसको भी मैं यज्ञ बाहर लाता हूँ और 100 साल की निरोग आयु प्रदान करता हूँ। कहने का अभिप्राय है कि हमारे प्राचीन शास्त्रों में इस यज्ञ चिकित्सा और वायु रूप आहार का अपने आप में एक बहुत बड़ा महत्व विशेष रूप से बताया गया है। और उसी आधार पे जो अनुसंधान की है उसमें भी अलग अलग मेडिसिनल कंपोनेंट से लेकर के अलग अलग बातें सामने आई हैं। और जब हमने प्रत्यक्ष रूप में जिनको कैंसर थे, जिनको कोमा की अवस्था में थे, जो अलग अलग बीमारियों की अवस्था में थे, उनको जब यज्ञ कराए गए तो आपको जानकर के आज जो भयंकर बीमारी की अवस्था में थे वो लोग भी जीवंत रूप में नव जीवन पाए, जो अथर्ववेद के मंत्र में मैंने कहा। और आपके ही वहां पर तेलंगाना में ही हमने पिछले कुछ समय पहले वहां प्रवास किया था और वहां पर हमने जब विशेष शिविरों का आयोजन किया था, पहले ऑनलाइन इसी प्रकार से किया था, तब उन्होंने प्रेरणा पाई थी। और बाद में जब ऑफलाइन किया तब जो आए हैदराबाद में ही महामाया जी, उनको ब्रेन ट्यूमर था और ब्रेन ट्यूमर इतना बढ़ चुका था जिसके कारण से उनको आंखों से दिखना बंद हो चुका था। डॉक्टर लोगों ने भी उनको बहुत ही सीरियस अवस्था में घोषित कर दिया था। उस समय उनको विशेष रूप से, और कैंसर की गांठ थी, नॉर्मल गांठ भी नहीं, उस समय कर्कट एष्टि से उन्होंने हवन किया और निरंतरता पूर्वक उसमें प्राणायाम किया, योगाभ्यास किया, यज्ञ पूर्वक योग किया मेडिकेटेड एयर के अंदर। आपको जानकर के आश्चर्य होगा, जब मैं गया तब वो फाइल लेकर के आए और उन्होंने कहा कि मेरे को दिखना बंद हो चुका था, सीरियस अवस्था में मैं थी, उस दौरान इसको चालू किया और आज मेरी रिपोर्ट भी नॉर्मल आ चुकी और मैं देख भी पा रही हूँ। इतनी हर्ष और उल्लास से भर करके अपनी ये बातें शेयर कर रही थी, हमें भी आश्चर्य हो रहा है। इसी प्रकार वहीं पर तेलंगाना में रुद्रपुर में हमारे आदरणीय माता जी, उनका नाम मैं भूल रहा हूं, तेलंगाना
प्रणीता जी
तेलंगाना रुद्रपुर में बहन प्रणीता जी, उनको लीवर का कैंसर था। लीवर कैंसर होने के बाद हैदराबाद में उन्होंने ट्रीटमेंट चालू किया। ट्रीटमेंट लेते हुए वो कैंसर 4-5 जगह पर शरीर में और फैल गया, तो डॉक्टर ने उनको मुंबई में ट्रांसफर किया।
ऑलरेडी है
जाने के बाद
आपके सामने है प्रणीता जी लाइव देयर फ्रॉम रुद्रपुर। अभी आपके सामने है, देखो मैं स्पॉटलाइट किया हूँ प्रणीता जी, प्लीज कंटिन्यू।
हाँ, तो बहन प्रणीता जी, फिर उनको मुंबई में ट्रांसफर किया, वहां पर वापस रिपोर्टें की गई, ये सारी चीजें की गई, तो उनको इम्यूनोथेरेपी लेने के लिए बताया। जब उन्होंने इम्यूनोथेरेपी लिया तो इम्यूनोथेरेपी के लिए 2.5-3 लाख रुपए का खर्च, एक डोज का, एक इंजेक्शन का। उसके बाद जो दवाइयां लेते हो, दवाइयों का खर्च अलग, मानिए कितना बड़ा खर्च। और ऐसे उन्होंने 6 डोज लिए, 6 इंजेक्शन लिए। 5 लेने के बाद जब 6ठा डोज लेने के लिए गए और जो रिपोर्ट कराया, उन रिपोर्ट में पाया गया कि वो कैंसर पूरे शरीर के अंदर फैल चुका है और डॉक्टर लोगों ने उनको मना कर दिया कि अब आप इसकी सेवा कीजिए, अब कुछ नहीं कर सकते हैं। उस समय जब वो घर पे आए, फिर हमारे आदरणीय विश्वनाथ महाजन जी, जो इस यज्ञ चिकित्सा को विशेष रूप से जानते हैं, उन्होंने उनको सजेस्ट किया, बताया, सिखाया और उन्होंने कर्कटेष्टि आदि से हवन करना शुरू किया। आपको जानकर के आश्चर्य होगा कि 6 जो इतने खतरनाक इंजेक्शन होते हैं कि कहते हैं कि वो एक बार एक इंजेक्शन लेने के बाद 25 से 45 दिन व्यक्ति खड़ा नहीं हो सकता है। और अब बहन की भी ऐसी अवस्था होती थी, अभी आप हमारे सामने साथ में जुड़ी हुई है, तो वो एक बहुत सीरियस अवस्था होती है। और उसमें भी कैंसर अब पूरा फैल चुका है और वो इतने 5 ऐसे खतरनाक डोज ले चुके हैं। और उसके बाद क्या अवस्था होती है शरीर की, आप सब जानते हैं। और उस समय उनके कमरे के अंदर यह कर्कटेष्टि आदि जो विशेष जड़ी बूटियों से हवन किया गया और उस हवन करने पर करीब 1 सप्ताह के अंदर, क्योंकि हर इंजेक्शन का उनका अनुभव था 25 से 45 दिन वो डोज लेने के बाद खड़े नहीं हो पाते थे। और इस बार ये इतनी सीरियस अवस्था में जाने के बाद जब यज्ञ प्राण के केवल 1 सप्ताह के अंदर वो खड़े हो गए और निरंतर यज्ञ और उसमें योगाभ्यास करने पर करीब 3-4 महीने के बाद जो उन्होंने रिपोर्ट कराई 61% कैंसर रिकवर हो गया, जो डॉक्टर लोगों ने जवाब दे दिया।
स्वामी महाराज अगर आप अनुमति दिए तो 1 मिनट के लिए 1 मिनट के लिए उनका अनुभव शेयर करें, क्योंकि लाइव तो है जी। All the participants, I think here there is a person named as Pranita Lakshminarsaya at Nizamabad district, Ruddur Bandal and Ruddur village. So brother Lakshminarsaya, government teacher, and his missus. So they will share their experience after performing this Yagna therapy. They accepted as Yagna therapy under the guidance of Pujya Swami Yagyadev ji. What result they found? It's a live example in front of us. I'm requesting Pranita ji, आप शेयर कीजिए। लक्ष्मण सर जी है क्या?
है। प्रणाम स्वामी जी।
ओम प्रणाम, नमस्ते जी। शीघ्रता पूर्वक अपने अनुभव को आप शेयर कीजिए। आज तो आप घर घर में लोगों को भी कराने लग गए हैं।
स्वामी
महाराज గారు మీరు
చెప్పండి।
చాలా మంచి గారు మీ అనుభవం షేర్ చేయండి, యూనివర్స్ షేర్ చేయండి।
హిందీలోనా తెలుగులో?
తెలుగులో, నో ప్రాబ్లం।
ప్రణామ్, నమస్కారం స్వామి గారు। మా మిస్సెస్ ప్రణీతకు క్యాన్సర్ వ్యాప్తి చెందడంతో విశ్వనాథ్ మహాజన్ మాకు మంచి సజెషన్ చేశారు। ఈ యజ్ఞం ద్వారా, యజ్ఞ థెరపీ ద్వారా మంచి రిజల్ట్ వస్తుంది, ప్రయత్నం చేద్దాము అని చెప్పేసి అనేసరికి అప్పటికే దాదాపు 50 lakhs పైన ఖర్చు పెట్టడం జరిగింది। అయినా తగ్గనటువంటిది ఈ యజ్ఞ చికిత్స ద్వారా యజ్ఞకుండంలో కర్కటేష్టి హవనం చేస్తూ దాంట్లోపల యోగాభ్యాసం చేయడం ద్వారా మంచి రిజల్ట్ వచ్చింది। లాస్ట్ 3 months బ్యాక్ రిపోర్ట్స్ లో 65% వరకు తగ్గినట్టుగా రిపోర్ట్స్ వచ్చినాయి। ఇంకా మేము అదే కంటిన్యూ చేస్తున్నాం। ఇంకొక 2-3 months లోపల అది పూర్తిగా తగ్గిపోయే అవకాశం ఉంది। అదే మా ఈ కర్కటేష్టి హవనం ద్వారా అయితే మంచి రిజల్ట్। అదే కాక మేము మా ప్రాంతంలో ఎవరికి కూడా ఈ వ్యాధి గురించి తెలిసినా కూడా అక్కడికి వెళ్ళి వాళ్ళకి అనుభవాన్ని చెప్తూ వాళ్ళ చేత కూడా చేయించే ప్రయత్నం చేస్తున్నాం అందరితో। స్వామీజీ నమస్కారం।
మీరు హైదరాబాద్ లో డిఫరెంట్ హాస్పిటల్స్ లో వెళ్ళారు కదా, హాస్పిటల్స్ గురించి చెప్పండి, మీరు ఎంత ఖర్చు అయింది?
బాంబే హాస్పిటల్, బాంబే టాటా హాస్పిటల్ కు వెళ్ళాము। అక్కడ 1 థెరపీ 3.5 lakhs ఒక్క ఇంజెక్షన్। మళ్ళా తర్వాత అక్కడ నుంచి ఇక కరోనా రావడంతో బాంబే పోవడం వీలుగాక ఇక్కడ హైదరాబాద్ లోని సోమాజిగూడ యశోద హాస్పిటల్, అక్కడ 3.5 lakhs ఒక్క ఇంజెక్షన్ కి, అట్లా 6 injections తీసుకున్నాం। అక్కడ తీసుకున్న తర్వాత రేడియేషన్ కారణంగా ఆమె ఒక 20 days పైన అసలు లేవలేకపోయేది, అసలు నడిచేది కాదు, ఏం తినేది కాదు, తాగేది కాదు, చాలా ప్రాబ్లం ఉండేది। అయితే ఎప్పుడైతే ఈ హవనం యజ్ఞం చాలైందో దాని తర్వాత ఈ థెరపీ తర్వాత నెక్స్ట్ డేనే హుషారైపోయింది, మంచిగా ఆమె పనులు ఆమె చేసుకోవడం అవన్నీ కూడా మంచి రిజల్ట్ వచ్చింది। 20-25 రోజులు లేవనటువంటి ఆమె ఈ యజ్ఞం తర్వాత నెక్స్ట్ డేనే హుషారైపోయింది। ఇది మాకు కలిగినటువంటి మంచి రిపోర్ట్ ఇది।
మీరు కేవలం యజ్ఞమా, యజ్ఞంతో పాటు యోగా చేసిరా?
యజ్ఞంతో పాటు అనులోమ విలోము, నాడీ శోధన, ఈ ప్రాణాయామము ఇవన్నీ కూడా చేయడం ద్వారానే రిజల్ట్। దాంట్లో హవనము, గుగ్గిలం తర్వాత
ఒకసారి ప్రణీత గారిని మాట్లాడించండి, ఒక్క నిమిషం। ప్రణీత గారు
నమస్తే స్వామీజీ। నమస్తే అన్నయ్య।
చెప్పండి అమ్మా, మీ అనుభవం ఒక్క సెకండ్ చెప్పండి।
నేను స్టార్టింగ్ లో ఎప్పుడు ఇంజెక్షన్ చేసుకొని వచ్చిన తర్వాత అసలు లేచేదాన్ని కాదు। ఈసారి యజ్ఞం చేస్తూ ఉన్నప్పుడు ఇంజెక్షన్ చేసుకొని వచ్చిన తర్వాత తొందర లేచిన। అప్పుడు నేను అనుకున్నా వీళ్ళు ఇంజెక్షన్ చేసిర్రా, డబ్బులు అయితే ఖర్చు అయిపోయినాయి, మరి నేనైతే ఇంత తొందరగా యాక్టివ్ గా అయినా, మరి నాకు ఇంజెక్షన్ అయ్యిందా కాలేదా అని కొంచెం అటు ఇటు అనుకున్న। ఒక 2-3 days డౌట్ ఉండే, నేను లేస్తున్నా వర్క్ చేస్తున్నా, మరి నాకు ఇంజెక్షన్ అయిందా అని అనుకున్నా। తర్వాత నాకు రియలైజ్ అయింది, లేదు మేము యజ్ఞం చేస్తున్నాం, యజ్ఞం ద్వారా ఈ రేడియేషన్ కాకుండా బయట నుంచి ఏ గాలి వ్యాప్తి కూడా చెందదు ఇంట్లోకి। ఖచ్చితంగా ఇది నేనైతే కరోనా టైంలో ప్రతి ఒక్కళ్ళకి ఇప్పటికి కూడా షేర్ చేస్తా ఉంటా, బయటకు వెళ్ళినప్పుడు ఎప్పుడు ఈ మాటను మాత్రం మర్చిపోను।
ఓకే అమ్మా, Thank you, Amma. I think there is a live example what Pujya Swamiji Maharaj expressed.
అసలు ఇంకా నేను డైలీ కూడా ఏదేమైనా కానీ చేస్తా. మొన్న ఒక 15 days మా మమ్మీకి కొంచెం కన్ను ఆపరేషన్ అక్కడికి వెళ్ళాను. ఇంకా అక్కడ ఏ డిస్టర్బ్ ఉంటుందో ఏమో అని చెప్పేసి చేయలేదు. ఆ ఒక 10 days నేను చేయలేదు కానీ కంటిన్యూగా ఉంటుంది ఇప్పటి వరకు.
Okay, okay. So after performing the Yagna therapy and doing the yoga, so there are a number of chronic diseases which can be solved. So that is Pujya Swamiji Maharaj expressing. There is a live example. Please, Swami Maharaj, आप कंटिन्यू कीजिए.
आदरणीय बहन जी तो हमारे साथ में जुड़े हैं और उन्होंने भी अपने अनुभव शेयर किए. सामान्य कंडीशन है कि बहुत सीरियस अवस्था में और बहुत ही क्रिटिकल अवस्था में जाने के बाद, जिसको मॉडर्न मेडिकल साइंस कहते हैं, उसमें जो टेक्नोलॉजी है, जो पद्धतियां है, प्रक्रियाएं हैं, स्पेशलिस्ट डॉक्टर है, स्पेशलिस्ट दवाइयां है, सब कुछ है, वो करने के बाद भी जिनको जीवन अब सामने नहीं, और 57 लाख रुपए खर्च किए थे और उस अवस्था में उनको कराया और जीवन पाए. और ऐसे एक तो नहीं, वहीं पे हमारे आदरणीय भ्राता श्री निवास जी, ये जो कोरोना काल में फंगस आया था, ब्लैक फंगस, उनको ब्लैक फंगस की समस्या हुई थी. तो कई बार उनके ऑपरेशन हो चुके और इतनी सीरियस कंडीशन में वो थे, और पूरा यहाँ से ऑपरेशन करके वो अंदर से पूरा फंगस आदि को बार बार सफाई करा रहे थे. सफाई करने के बाद भी जो दवाइयां हर महीने 50-50 हजार का खर्च, और लास्ट में डॉक्टर लोगों ने कहा कि ये ठीक नहीं हो सकता, और बढ़ता ही जा रहा था. लास्ट में आंख निकालने के लिए भी बोल दिया, और अलग अलग मतलब बहुत सीरियस कंडीशन में आ गए थे, पूरे शरीर से सूख चुके थे और अलग उसमें थे. उस दौरान भी उनको हमारे आदरणीय भ्राता विश्वनाथ महाजन जी ने उनको सिखाया, बताया और उनको कराया यज्ञ कि आप ये करो. और उन्होंने करना प्रारंभ किया. आपको जानकर के आश्चर्य होगा कि डॉक्टर खुद आश्चर्य में पड़ गए कि ये कैसे रिकवर हो गया. जो आंखों को निकालने के लिए अगले ऑपरेशन में बताया था, जो ब्लैक फंगस पूरी तरह से शरीर के अंदर फैल रही थी, वो पूरी तरह से खत्म हो गया. आंख ना निकालनी पड़ी. जो उनको दिखना बंद हो चुका था, वापस देखने लग गए. और भी अलग अलग जो समस्याएं, कॉम्प्लिकेशन थी, उससे वो बच गए. तो कहने का अभिप्राय है कि ये जो बड़ी बीमारियां कही जाती है, उसको भी जीत करके देते हैं. और सामान्य बीमारियां तो हमने इतनी देखी, सर्दी, जुकाम, बुखार, और छोटी मोटी जो बीमारियां हैं, अलग प्रकार की एलर्जी से संबंधित या डेफिशिएंसी से संबंधित जो बीमारियां होती है, वो तो दूर होती होती है. लेकिन ये जो केस आपके सामने में रख रहा हूं, ये वो केस हैं जिनको हम सब कुछ जो मॉडर्न मेडिकल साइंस में हम कर सकते हो, करने के बाद भी जो लाभ नहीं हो रहा है, उन लोगों को जो लाभ है, ये अपने आप में एक विशेष, एक अजूबा, एक चमत्कार होता है. तो वो चीजें हमने इस यज्ञ चिकित्सा के माध्यम से होते हुए देखा. और ये सामान्य नहीं, एक केमिस्ट्री है, एक कर्मकांड, पूजा पाठ या एक अदृश्य शक्तियों की पूजा, ये सब चीजें है. लेकिन ये केमिस्ट्री है कि ये द्रव्य डालने पर ये स्मोक बनेगा. आप 24 घंटा उस वायु के अंदर श्वास लेते हैं, उसमें वो आ जाता है, उसमें लेने पर वो लाभ होता है. सुगंधी आती है, उससे लाभ होता है. न्यूरोकेमिकल, मंत्र पाठ पूर्वक हवन करने पर न्यूरोकेमिकल बैलेंस होता है, उससे भी हमें विशेष रूप से लाभ होता है. जिस वायु के अंदर रहते हैं वो ऋण आवश्यक कण बाहुल्य हो जाता है, तो उससे ब्लड सीरोटोनिन बढ़ता है, तो उससे भी हमें लाभ होता है. पूरी बॉडी अल्कलाइन हो जाती है, उससे भी हमें लाभ होता है. यज्ञ से निकलने वाले जो पार्टिकल होते हैं, वो नैनो पार्टिकल होते हैं और मेडिसिनल पार्टिकल होते हैं. उसको भी हम जब इनहेल करते हैं, ग्रहण करते हैं, उसके संपर्क में रहते हैं, उससे भी हमें लाभ होता है. कहने का अभिप्राय, यज्ञ चिकित्सा मानी मल्टी चिकित्सा है. आपने म्यूजिक थेरेपी सुनी होगी कि अलग अलग प्रकार के म्यूजिक, अलग अलग प्रकार की चीजों को सुना करके जो चिकित्सा की जाती है. आप मंत्र का पाठ कर रहे हैं, म्यूजिक चिकित्सा भी है. यहाँ अग्नि, आपने सन थेरेपी सुना है, अग्नि की एक रश्मियां विशेष हमारे चमड़े के ऊपर पड़ने पर जो एक फोटो अंदर में केमिकल प्रोसेस चलता है, जिसके परिणाम स्वरूप हमें लाभ होता है. ये सन थेरेपी भी है, या म्यूजिक थेरेपी भी है, यह सुगंध एरोमा थेरेपी जो हम कहते हैं सुगंधी के माध्यम से, वो भी है. हम दवाइयां खाते हैं, मेडिसिनल कंपोनेंट के माध्यम से ट्रीटमेंट करते हैं, या इसके अंदर भी वो वायु के माध्यम से जाकर के उसका भी लाभ होता है. नैनो मेडिसिन के रूप में हम देखें तो नैनो पार्टिकल्स, मेडिसिनल पार्टिकल्स होते हैं, उसको भी हम इनहेल और उसके संपर्क में आते हैं, उससे भी हमारी चिकित्सा होती है. उस प्रकार से मल्टी लेवल से चिकित्सा करने. और एक हम अभी मॉडर्न मेडिकल साइंस में इस बात को अभी हम नहीं मानते, लेकिन आयुर्वेद की विद्या में प्रारब्ध जनित हमारे पुराने कुछ ऐसे कर्माशय हैं, पुराने ऐसे हमारे प्रारब्ध कर्म हैं, जिसके कारण भी वर्तमान जीवन में अलग अलग प्रकार के कुछ रोग और अलग अलग प्रकार की समस्या आती है, उससे भी हम बच सकते हैं. वो भी ये यज्ञ चिकित्सा, इसीलिए इसको देव व्यापार से चिकित्सा कहा गया, कि उस बीमारियों से भी हम जो बच सकते हैं. कम्युनिकेबल डिजीज से भी बच सकते हैं, नॉन कम्युनिकेबल डिजीज से भी बच सकते हैं, प्रारब्ध जनित बीमारियों से भी बच सकते हैं, वंशानुगत जो बीमारियां होती हैं उससे भी हम बच सकते हैं. और उसके लिए आज हमने एविडेंस बेस्ड मेडिसिन के तौर पे अलग अलग सामान, मधुनिष्ठ हवन सामग्री डायबिटीज के लिए, इसी प्रकार से प्रारब्ध जनित दोषों के लिए प्रारब्धेष्टि हवन सामग्री, ऑटो इम्यून डिजीज या मल्टीपल डिजीज के लिए ये प्राणेष्टि हवन सामग्री। इसके ऊपर हमने पूरे आज तक दुनिया में हवन सामग्री मिलती है, कोई एविडेंस के साथ नहीं, लेकिन हमने एक एक सामग्री का असराइडिहाइड, सिनेमेल्डिहाइड, प्रोलिन से लेकर के अलग अलग प्रकार के जूस सामग्री से हवन करने पर क्या पाया जाएगा, वो उसका पूरा जीसीएमआर डाटा और उसका पूरा एनालिसिस और पूरा रिसर्च डाटा के साथ हम इसको दे रहे हैं, एक मेडिसिन के तौर पे दे रहे हैं और अनुसंधान के आधार पे दे रहे हैं। हृदयेष्टि हवन सामग्री हार्ट आदि की संबंधित प्रॉब्लम के लिए, कफेष्टि हवन सामग्री कफ संबंधित प्रॉब्लम के लिए, चर्मेष्टि हवन सामग्री जो चर्म संबंधित अलग अलग प्रकार के रोग होते हैं उसके लिए, मेधेष्टि हवन सामग्री मस्तिष्क से संबंधित रोगों के लिए, कर्कटेष्टि हवन सामग्री कैंसर, गांठ इस प्रकार के रोगों के लिए, संततेष्टि हवन सामग्री निसंतानता, बंध्यत्व, धातुओं का पोषण आदि ना होना उससे संबंधित बीमारियों के लिए, पित्तेष्टि हवन सामग्री पित्त से संबंधित बीमारियों के लिए, वातेष्टि हवन सामग्री वात, गठिया, जोड़ों का दर्द, सर्वाइकल स्पॉन्डिलाइटिस आदि दर्दों से संबंधित बीमारियों के लिए। ऐसे 11 प्रकार की रोगानुसार हवन सामग्री और दिव्येष्टि और गोकुल 2 प्रकार के धूपन हवन करने के बाद अंगारों पर डालना। जो हमने आज अभी यज्ञ किया इस प्रकार से 5, 7, 10 मिनट रोग की अवस्था अनुसार, पहले जो रोग है उस रोग के लिए जो ट्रीटमेंट चाहिए, जो कंपोनेंट चाहिए, वो विशेष सामग्री का चयन करते हैं। उस सामग्री से अग्नि प्रदीप्त करके 21, 51 या 108 रोग की अवस्था अनुसार आहुति देते हैं। उसके उपरांत उसी जड़ी बूटियों के साथ गुगुल और गाय का घी मिक्स करके अंगारों के ऊपर डाल करके उसकी हल्की धुनी करते हैं और उसमें रहते हैं, उसमें प्राणायाम करते हैं, उसमें योगाभ्यास करते हैं। तो इन बीमारियों से, छोटी छोटी बीमारियों से लेकर के बड़ी बड़ी बीमारियों से भी हम मुक्ति पाते हैं। और 5 इंद्रियों की हमारी शक्ति, आंखों की देखने की शक्ति, कानों की सुनने की शक्ति, नासिका की सूंघने की शक्ति, जीवा की चखने की शक्ति, चमड़ी की स्पर्श करने की शक्ति, 5 इंद्रियों की शक्ति बढ़ती है, हम युवा बनते हैं। और उसके साथ साथ आयुर्वेद के अंदर विशेष रूप से देखिए, आपने सबने सुना होगा कि हम जिस जीवन को जी रहे हैं उसमें सबसे इंपॉर्टेंट आहार वायु, जो मैंने अभी आपको बताया, जैसी होगी वायु वैसी होगी हमारी आयु। आज हमने वायु प्रदूषण किया तो आज 70 लाख से अधिक लोगों की जान जा रही है। यही वायु हमारे ऋषि मुनि लोग यज्ञ, हवन, अग्निहोत्र आदि करके उत्तम रीति से वो निर्माण करते थे और उसमें रहते थे, तो वो लंबी आयु भी जीते थे, दीर्घ आयु भी जीते थे और उसके साथ साथ स्वस्थ आयु भी जीते थे। इसलिए अच्छी वायु का अपने घर के अंदर निर्माण करके उसमें रहेंगे तो आपको दीर्घ आयु भी मिलेगी और सुख आयु भी मिलेगी। इसलिए कहते हैं ना, जैसी होगी वायु वैसी होगी हमारी आयु। इसलिए स्वस्थ और दीर्घायु चाहिए तो हवन कीजिए। दूसरा, इसके साथ साथ और भी अलग अलग बहुत सारी चीजें हैं, लेकिन टाइम काफी ओवर जा चुका है, काफी सारा टाइम हो चुका है। और अधिक आप जानना चाहो तो यज्ञ दर्शन करके स्वामी यूट्यूब चैनल है स्वामी यज्ञदेव करके भी, यज्ञ दर्शन करके भी, आप उसके ऊपर जा करके आप देखेंगे तो वहां पर बहुत सारी इससे संबंधित अलग अलग रिसर्च डिटेल्स और बहुत सारी विधि पद्धति प्रक्रियाएं अलग अलग रोगों के लिए। और जो मैंने रोग आपको रोगों के इलाज बताए, ऐसे सैकड़ों सैकड़ों छोटे से लेकर के बड़े पर्यंत अलग अलग रोगों की वहां वीडियो आप साक्षात देख पाएंगे। कोई कैंसर से पीड़ित है, कोई पैरालिसिस, कोई पार्किंसन, कोई कुछ अलग अलग प्रकार के कोमा से लेकर के अलग अलग जो भयंकर बीमारियों के, उन बीमारियों से भी लोगों ने जो नवजीवन यज्ञ चिकित्सा से पाए उनके साक्षात अनुभव भी आप देख पाएंगे। उसकी विधि पद्धति प्रक्रिया, कौन से द्रव्य से हवन करना, वो सारी चीजें आप देख पाएंगे। तो आप उस यूट्यूब चैनल का विशेष रूप से सहयोग सहारा ले सकते हैं। और विशेष रूप से यज्ञदर्शन.com वेबसाइट है पतंजलि की, उसके ऊपर यज्ञ का ये पूरा हब है, उसके ऊपर भी जाकर के आप ये सारी चीजें आप देख सकते हैं। तो इसी के साथ में आप सभी हमारे अलग अलग इंस्टीट्यूट के सारे पदाधिकारी गण, अध्यापक गण, स्टूडेंट, विद्यार्थी गण, आप सबको मैं कोटि कोटि प्रणाम नमन वंदन करता हूँ। और उसके साथ साथ जुड़े हुए अन्य साधक कार्यकर्ता भाई बंधुगण और हमारे आदरणीय भ्राताश्री आदरणीय भाई किशोर भाई जी, जो विशेष रूप से इन सेवाओं में अपनी सहभागिता, अपनी भूमिका, अपना योगदान दे रहे हैं, उनको भी मैं नमन वंदन प्रणाम करते हुए अपनी वाणी को विराम देता हूँ। ओम शांति शांति शांति।
Thank you very much, Pujya Swami Maharaj. There may be some questions from participants. They will raise questions. I think you all may understood that through this half an hour, 45 minute session of Pujya Swami Yagyadev ji, what he want to explain, the gist of whole 30 minutes speech, lecture, it's very clear that what he says in future, there are various problems we are perceiving, like because of the corona, what we perceived, it is unable to take what I say, purified air, oxygen. So this yagna we must accept as a solution to purify our environment. It's purely we can consider as what I say, as purifying the air. Okay, and if you perform in that circumstance, full of oxygen centered and purified environment, so sure you will be benefited. You must perform yoga also. Yagna for purification, yoga for strengthening the internal body. So through this, sure, one thing is we will get the good health, and second thing, there are many problems can be solved. So Pujya Swami Yagyadev ji done many research activities with along with scientists of Patanjali Research Center. In the afternoon session, Dr. Vedapriya Garu, she will present various aspects, research centered aspects. So the thing is, there are many examples are there. Scientifically explained how the whatever medicinal plants if you are using in the yagna and creating the medicated environment, and during that environment if you are performing the pranayama and other thing, how the chronic disease is also solved. So he explained, especially with Pranita ji, the chronic what is this cancer problem solved through this by using the karkateshti samagri and continuously performed the pranayama. And there are a brain tumor problem we pursued in the Hyderabad Jiaguda Maya, and she also continuously performed yagna and yoga and solved tumor problem also. Like that, there are many there. So Swamiji is requesting that you please accept yagna as a therapeutic point of view and purify the environment and create a energetic environment. And wherever you are, your surrounding must be energetic and purified manner. So this is the solution for environmental problem, and also what I say is to get good health. So that is Pujya Swamiji Maharaj explained. So thank you very much Swamiji Maharaj. किसी को भी कुछ प्रश्न पूछना है वो एक दो प्रश्न आपको पूछेगा. So anybody want to raise? Yeah, our Dharmateja sir, Dr. Dharmateja sir, kindly raise your hand. Yeah, Dharmateja sir, kindly unmute your audio please. Yeah, once again sir, unmute your audio.
Hello, namaste.
Swami Maharaj, Dr. Dharmateja ji, one of the assistant professor in the Osmania University Department of Education, and highly involved in various yagna related activities. Whole family is fully involved. So Dr. Dharmateja ji.
Namaste ji,
Yeah,
namaste.
he belongs.
Friends,
Please.
ఫ్రెండ్స్ ఇప్పటి వరకు స్వామీజీ గారు చాలా యజ్ఞ థెరపీ సంబంధించిన విషయాలు చెప్పారు. మన శాస్త్రం ఏం చెప్తుందంటే యజ్ఞో వై శ్రేష్టతమం కర్మ. మనము సామాజిక కార్యంలో భాగంగా నలుగురికి అన్నదానం చేస్తాము, నలుగురికి వస్త్రదానం చేస్తాము, ఇంకా ఎంతమందికి ఇంకా రకరకాల దానం చేస్తాము, భూదానం చేస్తాము, విద్యాదానం చేస్తాము. అయితే ఇవన్నీ దానాలు మంచివే, దానికంటే కూడా ఇంకా మంచిది సూపర్లేటివ్. అందుకొరకే యజ్ఞో వై శ్రేష్టతమం కర్మ అన్నారు. అందుకొరే యజ్ఞం ఇంకా మంచిది అన్నిటికంటే, అది దాన్ని ఆచరించాలని స్వామీజీ గారు చాలా మనకు విషయాలు చెప్పారు. నన్నందరికి సైన్స్ ఏం చెప్తుందంటే పదార్థము ఏది కూడా నశించదు, నాశనం కాదు, అది కేవలం రూపాంతరం చెందుతుంది, తన రూపాన్ని మారుస్తుంది. యజ్ఞంలో మనము ఆవు నెయ్యి, వనమూలికలతో తయారైనటువంటి సామాగ్రి, ఔషధియుక్తమైనటువంటి సామాగ్రి మనము ఆహుతులకు ఇస్తాం. దానివల్ల అనుకొరకే భగవద్గీతలో అన్నారు, అగ్ని వై దేవానా ముఖం, అగ్ని దేవతలకు ముఖం లాంటిది. అగ్నిలో వేసేటటువంటి పదార్థము అది భస్మమై సూక్ష్మమై వాయు లోపల చొచ్చుకుపోతుంది, భూమిలో చొచ్చుకుపోతుంది, ఆకాశంలో చొచ్చుకుపోతుంది, మొత్తం వాతావరణాన్ని శుద్ధి చేస్తుంది, వాయుమండలాన్ని పవిత్రం చేస్తుంది అన్నటువంటి మాట స్వామీజీ గారు చెప్పారు. అందుకొరకు చాలా మంది ఈ రోజు అంటుంటారు, మనం యజ్ఞంలో వేసి పదార్థాలని వేస్ట్ చేస్తున్నాము, 1000 రూపాయలు 1,00,000 రూపాయలు ఖర్చు పెడుతున్నాం. అది తప్పు. మనం విద్యాదానం చేస్తే 100 మంది చేస్తాం, 1000 మంది చేస్తాం. భూదానం చేస్తే 100 మంది చేస్తాం, 1000 మంది చేస్తాం. అదే యజ్ఞం చేయడం ద్వారా యజ్ఞం యొక్క పొగ ఎక్కడైతే వెళ్తుందో అక్కడక్కడ కేవలం మనుషులకే కాదు, పశు పక్షాది ప్రాణులందరికీ కూడా హితం చేకూరుస్తుంది, మంచి చేకూరుస్తుంది, వృక్షంలో కూడా దోహదపడుతుంది, మంచి చేకూరుతుంది. అటువంటి పవిత్రమైనటువంటి ప్రక్రియ గురించి మన స్వామీజీ గారు చాలా వివరంగా సంక్షిప్తంగా చెప్పారు. అంతేకాదు మనం గతం లోపల మనం వంట చేసే ముందు పొయ్యి మీద వంట చేసేవాళ్ళం, అగ్ని కట్టెల పొయ్యి మీద. ఆ వంట చేయగానే దానిలో ఉన్న పదార్థాన్ని ఫస్ట్ మనం అగ్నికి సమర్పించే వాళ్ళం, అది కూడా హోమం యొక్క ప్రక్రియని. సో అట్లా దాన్ని మనం రాను రాను మర్చిపోతున్నాము. ఇవాళ మనం మొత్తం గ్లోబల్ వార్మింగ్ అని ఫేస్ చేస్తున్నాము. పెద్ద గ్లోబల్ వార్మింగ్ ఎందుకైతుంది? ఇవాళ పంచభూతాలు, మనం తినేటటువంటి భోజనం ఎక్కడ దొరుకుతుంది? భూమిలో దొరుకుతుంది. మనం పీల్చేటటువంటి గాలి, వాతావరణం, వాయువు నుంచి దొరుకుతుంది. నీళ్లు తాగుతాము. ఆ పంచభూతాలను మనం ఉపయోగించుకుంటున్నాం, కానీ వాటిని పవిత్రం చేసేటువంటి ప్రక్రియ మనం చేయడం లేదు. అటువంటి పంచభూతాలను పవిత్రం చేయాలంటే కేవలం యజ్ఞం ద్వారానే చేయగలుగుతాము. కేవలం అంటే కేవలం యజ్ఞం ద్వారానే. అందుకొరకే గతంలో ప్రతి ఇంట్లో యజ్ఞం చేసేవాళ్ళు. మన చాణక్య మహర్షి ఏమన్నాడు తెలుసా? ఏ ఇంట్లో అయితే వేద మంత్రాల యొక్క ఘోష జరగదో, ఏ ఇంట్లో అయితే హోమం యొక్క పొగ పారదో ఆ ఇల్లు కాదు, అదొక శ్మశానం అన్నారు. అంత పెద్ద మాట అన్నారు. కాబట్టి మనము సైన్స్ ను గుర్తించుకొని మనం బాధగా మర్చిపోయినటువంటి యజ్ఞ ప్రక్రియను, యజ్ఞ థెరపీని మళ్ళీ జీవితంలో యోగంతో సహా యజ్ఞాన్ని కూడా నిత్య జీవితంలో రోజు దినచర్యగా పాటిస్తే తప్పనిసరిగా మనలో ఉన్నటువంటి పర్సనల్ గా మన వ్యక్తిగతంగా ఉన్న దోషాలు దూరం అవుతాయి. మొత్తం సమాజంలో ఉన్నటువంటి దాన్ని ప్రక్షాళన చేసిన వాటి మొత్తం నిత్యం అతివృష్టి అనావృష్టి ఏవైతే కలుగుతున్నాయో ప్రకృతి కోపం ద్వారా అవన్నిటిని కూడా దూరం చేయడానికి ఆస్కారం కలుగుతుంది. కాబట్టి मैं ज्यादा न कहते हुए पूज्य स्वामी जी महाराज अपने थोड़े से समय में यज्ञ द्रव्य के बारे में बड़े विस्तार के साथ उससे क्या क्या लाभ होते हैं हमारे को ही नहीं है, मनुष्य मात्र के नहीं, पूरे प्राणी मात्र को क्या क्या लाभ पहुंचते हैं, उन्होंने संक्षिप्त रूप से बड़े अच्छे ढंग से उदाहरण के साथ पूरा व्यक्त किया है। उनको यूनिवर्सिटी कॉलेज ऑफ एजुकेशन, हमारे SOE और ICSSR सभी एजुकेशन के विभागों के तरफ से मैं हृदय से उनके साधुवाद देता हूँ, धन्यवाद देता हूँ, उनको नमन करता हूँ। धन्यवाद स्वामी जी महाराज, धन्यवाद। ओवर टू किशोर।
Thank you very much, Dr. Dharmateja sir. No doubt at all, Pujya Swamiji Maharaj spending few minutes, that itself it's a great thing for us. It's nothing but it's a kind of blessings. Thank you very much, Pujya Swami Maharaj. If anybody want to raise question, you can. And after that, actually, it is expected that today Param Pujya Swami Ramdev Ji Maharaj will be attend. So, but I think you all may know that Pujya Swami Ramdev Ji Maharaj during these days, especially now the days are for International Yoga Day celebrations, very much busy in various activities. If possible, till tomorrow he may join. So we will expect Pujya Swamiji's blessings will get. So thank you very much. We'll go for next activity. So over to Dr. Lalita Madam. Next. Two minutes.
Namaste to all. Thank you, Swamiji, for the wonderful demo session for us on Yagna therapy. And now we will move on to the regular protocol yoga practice demonstration by Mr. Kishore sir.
Sound box is yeah. ఈ వీడియో ఉందా బాబు? ఈ వీడియో ఏం so now thank you very much. Thank you, madam. Now we'll move this. Yeah. The next session will be resource lecture. Dr. Sundarraj Perumal Garu, at least mostly sir will join at sharp 11:30. Because the intention. We want to seed a kind of curiousness and interest towards practicing the yoga. So all these 3 days training on yoga protocol and national webinar, all the days, every day we are practicing these common yoga protocol. By that, all the participants may understood that this much of minimum, if you practice this common yoga protocol, that itself will give us a good health. And everybody can practice. Everybody can practice. In that way, Ministry of Ayush, Government of India prepared a common yoga protocol, and the entire world is following during this Yoga Day celebrations. That's phone sound. So now we'll start. I'm requesting everyone, all the teacher educators and teachers, you please just focus and practice. And the intention is you must be empowered. Then that must be taught to all your student teachers. And every college must celebrate this 21st Yoga Day at your respected colleges. So this session will be very much helpful. Now we'll move for yoga protocol with by chanting the Veda mantra. Sangachatvam Samvadatvam Samvamanasi Janata Deva Bhagam Yatha Purve Sanjanana Upasate Sanjanana Upasate. Meaning, may you move in harmony, may you speak in unison, let our mind be equanimous like in the beginning, let the divinity manifest in your sacred endeavor. Now we'll start with the losing practices. I request everyone to stand up. The first, if you want to start the yoga, we must do some of the losing practices. By that, you can reduce the all kind of toxins, and also there is a scope for full of blood circulation in the body, and you can prepare your body. By that, your body can support to practice the asanas and the pranayama. First, sitting, crossing. Yeah. So now we'll do with the head exercise. You please just concentrate on this common yoga protocol. How disciplinedly given. First we must focus on head. Then we must go for shoulder. Then we must go for waist. Then knee. Then whole body must be stretched in a disciplined manner. By that, whole body will activate and prepare. As per Thorndike, I think you may know that readiness. You are making your body to ready to practice the asanas. Then we will go for asanas, standing asana. Then pranayama. Then dhyana. Yeah. Ana, this side, this side. Ana, నీకు కొంచెం కష్టపడతాయి వచ్చా ఇటు పట్టు సిస్టర్ పట్టు First, we must practice head exercise. Keep your hands at waist and slowly, kindly practice slowly. Breathe out and slowly come down towards front side. Your chin must touch with your chest and slowly breathe in. Go back side, head must bend towards back side and stretch your throat. Very good. And again, come front side, breathe out. Beautiful. Must practice slowly and focus on when you are back side, must focus on throat, Vishuddha Chakra. And when you are head towards front side, focus on neck. Very good. Breathe out. Then come back. The second aspect, turn towards right side. Your right ear must touch with shoulder. Breathe out. Twist it. And breathe in. Please turn towards from right to left. Now left ear must touch with the left shoulder and breathe out. Again, from left to right, breathe in and breathe out. Then right to left, slowly breathe in and breathe out. Right? Then third aspect in the head exercise, must twist your whole head towards right side. Turn towards right side, breathe in and breathe out and twist it. Focus on sides, focus on neck. Then slowly from right to left, twist it and focus on sides. Left to right and right to left, right? Then now head rotation. Slowly practice, please. When you're upward, clockwise, breathe in. Then when you're downward, breathe out. When you're upward, focus on throat, breathe in. When you're downward, focus on neck, breathe out. Like this, rotate 3 to 5 times. Then anti-clockwise, slowly breathe in and focus on throat. And breathe out, focus on neck. So rotate itself slowly with smile face. Don't do hurry burry. Slowly, please practice. Most useful for spondylosis as well as disc. Then rub your hands and use with what I say, with the warm hands. You please massage your neck. Then massage your throat. Excellent. Now you go for second aspect, shoulder exercise. Then raise your hands, shoulder movements. Ekam, dvi, trini, chatvari. Other side also, you can do it like this. With the breathe in, breathe out. Excellent. You can rotate, wrist rotation. Fold your fingers and rotate your wrist. When you're upward, breathe in, breathe out. Do it slowly. Breathe in, breathe out. Focus on disc. Breathe in, breathe out. Opposite direction, anti-clockwise. Breathe in, breathe out. Do it slowly. Right? Relax. Now, shoulder rotation. Slowly. Breathe in, breathe out. Breathe in, breathe out. Opposite direction. Breathe in, breathe out. Simple exercise. Everybody can perform. You can sit in your on chair also. You can sit on chair and you can do it. Now we'll go for waist rotation. Raise your hands. Keep it little bit distance between two legs. Slowly turn towards right side. Very good. Fold your right hand back side. Keep your left hand and shoulder. Twist it and focus on sides. Breathe out. Again, come back slowly. From right to left. Your waist must turn towards other side. And bend your right hand, left hand back side. Right hand and shoulder. Twist it. Right? You can do it rapidly. Ekam. Dvi. Trini. Chatvari. Pancha. षट. Like this you can perform 10 to 15 times. By that you are activating the waist. Now we'll focus on knee. Raise your hands. Keep it little distance and make it balance in the body. And slowly come down. Focus on knee. Breathe out. Beautiful. Beautiful. Again. Breathe in and come back. Breathe out and off sitting. Breathe in and come back. Breathe out and off sitting. Breathe in. You can do full sitting. Ekam. Dvi. Trini. Chatvari. Pancha. Like that you can do 10 times, 15 times, 20 times. So dear teachers, without doing, nothing can be possible. You must spend little time for the sake of your health only. Okay, do small things and you will get a constructive result. Okay, now we'll focus. Next aspect, stretching the whole body. Raise your hands. Very good. Then please focus, interlock it and keep it your hands on head. Tadasana. Okay, stretch your whole body towards upward on your leg finger. Stretch it, stretch your hands towards upward. Very good. Focus on stomach, Manipura. Focus on under the stomach, Swadhisthana. Very good. Stretch it, stretch it, stretch it. Come down. It's a simple exercise, stretching the whole body, stretching the all your bones, okay, and activating the internal organs. Once again, stretch it, breathe in. Very good, very good. It is most useful for children to increase the height. Very good. Tadasana. Come down. Relax. You can perform 2 minutes, 3 minutes, 2 times, 3 times. Okay. Then we'll go for next important aspect is what? balance is required in the body and mind. Now we'll perform Vrukshasana. Keep it your right leg at left knee. Okay. Then balance it by raising both the hands. Balance your body and slowly raise your hands and close it. Raise your hand and close it. Stretch your whole body towards upward. Very good, very good. Stay few seconds and focus. Body and mind must together. Very good, very good. Stay few seconds. Stay few seconds. Stretch your whole body towards upward. Try to focus on between the two eyeball. Relax. Other side. Now we'll keep your left leg at the right knee and balance your body. Balance it. Raise your both the hands and close it. Stretch your whole body towards upward. Stay few seconds. There must be balance between body and mind. Okay. Union between body and mind is required. Stay few seconds. 5, 4, 3, 2, 1. Come back. So this simple exercise will give us balanced state in the body and mind. And some of the people, children may be hyper, so they may be with a hypertension. So you can solve this hypertension by practicing the Vrukshasana. Okay, I will go for Urdhva Hastasana, then Pada Hastasana. Breathe in, Urdhva Hastasana, focus on throat. Breathe out, Pada Hastasana. Your forehead must touch with knee. Pull your navel inside, breathe out. Again come back, breathe in. Is it clear? This is what? Pada Hastasana. Now we'll go for next simple exercise, that is Ardha Chakrasana. Keep it hands at rest. Slowly keep it distance between two legs, little distance. Balance your body and slowly bend your body towards back side as possible as. Very good. Stretch your throat. Stretch your throat. Focus it. Very good. Few seconds. 5, 4, 3, 2, 1. Come back. It's a simple exercise which is most useful for to keep your thyroid in a balanced manner. No hypo, no hyper. You can keep this hormone in balanced state by practicing the Ardha Chakrasana. Once again, bend towards back side. And you must practice Ujjaini, you must practice Kapalabhati. And few are asanas which are very much useful for maintaining the balanced state in the thyroid. Very good. Come back. Relax. Now we'll move for next asana, Konasana. Keep a distance between two legs. Raise your hands. Turn towards right side. Slowly bend your body towards down as possible as till ankle. And make it an angle. Focus on left hand fingers. Very good. Breathe out. And come back. Slowly breathe in. And turn towards right side. Bend your body towards right side. Till ankle. Make it angle. You can do it. You can stretch whole body by bending the hands towards right side. You can do it in rapid manner. Ekam. Dvi. Trini. Chatvari. We can do it like this 100 times. Okay, whoever facing obesity problem, you must practice like exercise, vyayama, 100 times. Most useful. It reduces fat at stomach, fat at back, fat at sides. Okay, you must perform with a smile face. Relax. Is it clear? Now we finished standing asanas. Now we'll go for sitting asanas. Please sit down. Very good. Now, in the sitting, Please focus. This is Dandasana. It's a relaxed posture. You must keep hands backside and head must towards backside. Smile face. Relax yourself. It's a simply relaxed posture. Everybody can sit. Is it clear? You can reduce fatigue, stress, and increase energy. So the first asana, Dandasana. Keep your hands beside and breathe in. Stomach must go outside. Sahaja Bastrika. Then breathe out and press your hands and pull your navel inside. Very good. Focus on navel. Again, breathe in. Your stomach must go outside. Breathe out. Press your hands. Pull your navel inside. Focus on navel. Dandasana. Again, relax. Everybody clear? You are activating your stomach. Now please fold your right leg and then left leg. Please sit in the Vajrasana. Your spine must be straight, right? Sit simply. Most useful to improve your digestion system, digestion ability, okay? Most useful. We must sit in Vajrasana after taking the food. Few minutes must sit, practice it. You are able to sit 5 minutes means there is no toxins in the body, right? We'll go for next asana. Again, most useful for thyroid. Sorry, before that we must do the Uttana Mandukasana. Keep it right hand backside, then left hand backside, make it a cross at backside like this. Make it cross. Is it clear? Now stretch your whole body towards upward. Breathe in. Very good, very good. Stretch it. Then relax. Once again, breathe in and stretch your whole body. Very good, very good. Relax. This is called Uttana Mandukasana. You are strengthening your respiratory system. Now we'll go for Ardha Vrishtasana. Keep your hands backside. Slowly bend your body towards backside. Slowly focus on throat. Very good, very good. Must practice. There is no excuse at all. Every day must spend few minutes. Come back. Ardha Vrishtasana. Use both the hands. Carry both the ankle and bend your body towards backside. Stretch your throat. Breathe in. Stay few seconds. 5, 4, 3, 2, 1. This is what? Vrishtasana, camel posture. Most useful for thyroid, spine, to reduce your stress. Very good. Come back. Relax. Again, sit in Vajrasana. After bending your spine backside, you must perform counter asana. You must bend your body front side also. So now we'll perform Shashankasana. Raise your hands. Breathe in. Stretch it. Slowly come front side. Keep it your forehead on earth. Complete breathe out. Stretch your both the hands. Relax yourself. Relax. Again, come back. Breathe in. And slowly come down. Breathe out. Relax. Come back. This is what? Shashankasana. You must take few seconds. I'm doing rapidly because I want to review the protocol. Now we'll go for Vakrasana. Bring your right leg near the thigh and keep it right hand backside. Raise your left hand and twist it and carry the right knee. Turn towards right side. Breathe in. When you are breathing, after doing the inhale, your stomach must go outside. This is Antar Pranayama. Then breathe out. Pull your navel inside. Okay, you can do it both the bandhanas. Mula bandhan, Uddiyana bandhan. Stay few seconds. Press it here. There must be 4 centers. Your pancreas, your stomach, your kidneys. Relax. Is it clear? Most useful with this Vakrasana. You can solve diabetic problem. Again, other side. Do it slowly. Turn towards left side. Press it, breathe out and pull your navel inside. Focus on stomach. Focus on under the stomach, pancreas, kidneys, sides. Relax. Is it clear? This is Vakrasana. Almost we perform sitting asanas. I forgot one thing is, most important is what? We must do it butterfly. Named as Baddhakonasana, Patangasana. Most useful, Bhadrasana. You can do Mula Bandhan. By doing the Mula Bandhan, there must be movements in both the legs. Keep it smile face and ask with Almighty, oh Lord, give me energy. From the bottom to top, energy must flow. Most useful, there will be multi results in the Bhadrasana. Everybody must practice, especially children and women must practice this Baddhakonasana few minutes. Now we'll go for lying posture. Nice. Now we'll focus on downward lying asanas. Makarasana. Keep it distance between two legs. Must use one hand and another hand and keep it head on hands. Your head must turn towards left side. Relax yourself. It's a relaxed posture. Focus on back, spine. Your spine must be active, healthy. So this is the key principle to improve your lifespan. You must save your spine. Most useful this Makarasana. Then you bring it both the leg near and use your hands and keep it as chin. And there must be movements with the legs. Single leg, ekam, dvi, trini, chatvari. Most useful. You will get instant relax. Okay, you can do it while sleeping on your bed. Okay, you can move both the legs. Most useful. Instant ga nadumu noppulu povalante tappakunda cheyalandi. Chala simple exercise. మీ spine ni activate చేయడం మీ నడుము నొప్పులు వెళ్ళిపోవడానికి చాలా ఉపయోగపడుతుందండి. Relax. I will go for Bhujangasana. Again relax in Makarasana. Then keep your hands beside and bring it both the legs near. First we'll do Sarana Bhujangasana. Keep it hands till elbow on earth. Then raise your front body towards upward till your chest. Whole body must raise like snake. Snake posture. You can close your anus and focus on anus. Stay few seconds. Slowly come down and breathe out. Sarala Bhujangasana. The second posture, again in Sarala Bhujangasana, you must keep hands like dips. Then please slowly raise your whole front body towards upward till navel. Very good. Close your anus, close your navel. Mula Bandhan, Uddiyana Bandhan. Very good. Pull your navel inside. Focus on Mula Bandhan. Most useful, simple exercise, Bhujangasana. Majority of physiotherapists will suggest. Again, come back. You can do rapidly. Keep your hands front side, left hand, right hand and left hand. And raise your front body like this, like snake. Breathe in. Then breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. You can do rapidly and plenty times, right? We'll go next step. Relax. In every asana, please remember that there must be some pause between two asanas. And keep it hands under the thigh. Both the legs must be near. We'll raise one by one. Sharabhasana with single leg. Raise your right leg. Body must be in center. Whole leg must be upward. Stretch your leg fingers. Stretch it. Stretch it. Stretch it. Come down. Now with left leg, raise your left leg as possible as, and stretch your leg fingers. Focus on whole leg. Stretch it. At sciatic. Slowly come down. Only the high BP people don't do it. Remaining all can perform Shalabhasana with 2 legs. Raise your both the legs till the navel and stretch your leg fingers. Stretch it. Beautiful, simple exercise. Shalabhasana. Relax. Most useful for spine. Useful for sciatic problem. M&D problem, you know that. Muscular problems can solve. Relax yourself. So like this, Makarasana, Bhujangasana, Shalabhasana. I will go for forward lying, turn towards left side. We'll start with a single, what I say is Ekapada Uttana. Raise your right leg. Very good. Breathe in. Stretch your both the hands. Force it on it. Stretch your leg. Slowly come down. Again, we'll do second leg. Raise your second leg, left leg. Then force must give the with your hands on it. Raise your right leg. Stretch it. Come down. Okay. Now we'll do with the 2 legs. Vipada Uttana. It is also named as Ardha Harasana. You can pull your navel inside. Press your both the hands on it and raise your both the legs towards upward. Focus on stomach. Stay few seconds. 5, 4, 3, 2, 1. There must be some vibration set navel. Slowly come down. Slowly come down. Is it clear? This is what? Ekapada Uttana, Ardha Harasana. We'll go for most important asana. Everybody must practice. Bring both the leg near. Raise your best towards upward. And use your both the hands as pillar. Okay. Take base with the hands. Very good. Very good. Raise whole body towards upward. This is the bridge posture. Right? Here you must do it Tribandhan. First breathe out and pull your anus, Mulabandhan, Ashwini Mudra. Then pull your navel inside and body must be upward and navel must be inside. And chin, close your chin. Mulabandhan, Udyana Bandhan, Jaladhar Bandhan, Mahabandhan. Stay few seconds. 5, 4, 3, 2, 1, 0, 0, 0. Most useful, simple asana, that is Setu Bandhasana. You can carry both the ankle and raise your whole body towards upward and do it Tribandhan. Your bones will be strengthened, right? And also there is a full of blood circulation will be possible, and you can solve chronic problem like piles, fistula, discharge, old age problems. Mainly prostate problem, reproductive related problems, you can solve it. By doing this simple asana, I'm sure that there will be multi benefits. Come down. Is it clear? Now we'll go for Pavana Muktasana. Fold your right leg and press your right stomach, right side stomach. Okay. So whoever facing spine problem, this problem, you press it this much only. Don't raise body towards upward. If there is no problem, then raise your whole body and chin must touch with the knees. Press your stomach. Very good. Remove toxins. Come back. Other side. Fold your left leg. Press your left side of the stomach and chin must touch with the knee. Breathe out. Remove the toxins. Clear? Then with the 2 legs, press your stomach and breathe out. Raise your whole body. Chin must touch with the knees. Very good, very good. Stay few seconds. This is what? Pavana Muktasana. Removing the toxins. You can move like this. to make flexibility in the body. And it's an exercise for back also, right? But must practice slowly. No hurry, no worry. Very good. This is simplest exercise. Relax. So dear teachers, I think you may understood that asanas are thousands of asanas are there. We must select few asanas based on our requirement, either standing or sitting or forward lying or downward lying. So must practice first loosening exercises. So now we'll go for, after completing the asanas, we must practice yoga nidra, shavasana, relaxing the body. Okay. So keep it distance between two legs, keep it distance between two hands, make it V shape, and your head must turn towards left side. Uttam sharirani free ga pettalandi, loose ga vidichipetesayandi. I am not a body. I am not a mind, something beyond. Relax yourself. Focus. No thoughts at all. Kindly focus what is going inside. Focus on breathe in, breathe out. You can do it chakra dhyana. Focus between the forehead, between the two eyeball, Ajna chakra, center of the forehead, Manish chakra, top of the head, Shikha, Sahasrara chakra. Okay, left brain, right brain, mid brain. Again, focus on face, smile face, your eye, your ear, your nose, everything relax. Focus on throat, no hypo, no hyper. Relax yourself. Focus on shoulder. Focus on elbow. Focus on wrist. Thumb finger, middle finger. Sorry, ring. Index finger, middle finger, ring finger, little finger. Again, come back. Wrist, elbow, shoulder, throat. Slowly come down. On chest. Your respiratory system must be strong. Your heart. Concentrate on anahata sounds. Beautiful. Loved up, loved up. Focus on Manipura chakra. At navel. Digestive system must be proper. Focus on under the stomach. Swadhisthana. Pancreas, kidneys. Focus on anus. Excretory system. Mooladhara bandhan. Focus on sexual organs, thighs, knees, pindalini, and foot. Whole body relax. Come back. Again, slowly. Ankle, pindalini, knee, thigh, sexual organ, anus, and under the stomach, the swadhisthana. Focus on spine. L6, L5. Slowly upward, L4, L3, okay, L2, L1. Focus on neck. Focus on backside of the head. Focus on head, Sahasrara chakra. Forehead. Relax. Relax yourself. Please silent side focus. Chant Omkara. In this way, please relax yourself and slowly bring your two legs. Stretch your whole body like Tadasana. Turn towards right side, breathe in, breathe out. Turn towards left side, breathe in, breathe out. Use your right hand, front side, with the help of right hand. Get up and rub your hands. Keep it your warm hands on your eyes. Relax. Open your eye and see the hands. Dear teacher, almost after performing the asanas, we must practice pranayama. Thank you one and all. Now we must go. We must go pranayama. Everything is ready. So Kapalabhati, Anuloma Viloma, Brahmari, and Udgita. These are the part in the yoga protocol. So now I will end with this mantra. Om sarve bhadrani pashyantu sarve santu niramaya sarvetra sukhinas santu sarve santu niramaya sarve bhadrani pashyantu ma kaschit dukkhamat bhavet. Om shanti shanti shanti. Thank you one and all. Now we'll move for resource lecture. Over to Madam, Dr. Lalita Madam.
Thank you, Kishore, for the Namaskaram, sir.
Wait a second. Wait a second. I will make it.
Dr. Sundaraj Redmani, sir, is MD Ayurveda and MSc Psychology, Director for Yagyadev Ayurvedic Research Institute, Visakhapatnam. Sir is member National Coordination Committee (IP), All India Council of Technical Education. Sundaraj Redmani, sir, is Chief Physician in Yagyadev Ayurvedic Hospital. It has 3 branches, one branch in Hyderabad and other in Vizag. Sir is specialist in Panchakarma therapy and 3 chronic diseases like back pain due to this prolapse, disc degeneration, and cervical spondylitis, osteoarthritis, and rheumatoid arthritis. Sir treated more than 300 disc prolapse cases with Yagna. Sir teaches, and it is Sir's passion to teach yoga and sattva vidya to the patients. And Sir also conduct various seminars and workshops on health awareness, provide free training to students and young doctors in Panchakarma. Sir has conducted more than 1,000 Varnam, conducted Ayurvedic exhibitions and Vasanta Ritu Varnam camps in various places, and this is one of the most passionate thing for Sir Sundaraj Redmani, sir. Sir, namaste, sir, and we welcome you to the session. Thank you very much.
Thank you for the introduction, madam, and namaste, Kishore ji.
Namaste, sir.
So, I'll try to share my PPT again.
Sir.
So my audio is
Yes, sir, it's very clear, sir. It's very clear.
Thank you so much. And my slides, they are visible?
Yes, sir. Yes, sir.
Okay. Ajnanatimirandhasya jnananjanashalakaya chakshurunmilitam yena tasmai Shri Gurave Namaha. So I bow down to all my gurus who have used this jnananjana shalaka to remove the timira or andhakara called ajnana and opened my eyes towards the knowledge and wisdom of this world. Thank you so much for giving me this opportunity. I am Dr. Sundaraj Firmal, practicing the past 18 years in Yagyadev Ayurveda Research Institute, and we specialize in spinal diseases. So I would like to share my experience about this particular dreadful disease, dreadful problem. Every one person in every 4 people, they experience some kind of back pain. Once in their lifetime, every one of us will experience this excruciating pain called back pain. And scientists say that this back pain is the most painful condition a person could possibly experience in his or her life. Unlike other pains, here the nerve is getting twisted, pinched, and compressed, and because of that the muscles, they get contracted, and the entire limb and the lower back region, the neck region, each and every part sends signals to brain that something is happening in my backbone, something is happening, something is pinching, something is crushing my nerves, something is crushing my spinal cord, you please do something. And these pleas for help can be experienced by the patients in the form of severe excruciating back pain. So why this pain? What's the reason for this particular pain? If you look at all the other animals, they walk on 4 legs, unlike human beings who walk on 2 legs. And the backbone is horizontal in all these animals and vertical in only human beings. The whole weight is being taken by the spine, and particularly the lower back part, which takes the whole weight. And that, my dear friends, is causing a lot of trouble in people, particularly whose posture is faulty. Our backbone is not a single bone. There are around 33 separate bones. We call them vertebrae. They are completely separate bones, and in Telugu we call them venupusa. Venupusa is like a bead with a hole in it. If you look at the picture on the left top corner, there is a hole in it, and through the hole of this bead, spinal cord passes through. Spinal cord is an extension of the brain. It is like a tail of the brain, and it passes through the holes of this beads called vertebrae, and we get this backbone, which is like a chain of beads, which is very, very flexible. It's not like a single bone. And if you observe, a pair of nerves come out of the spinal cord at every joint between 2 vertebrae. A pair of nerves come out of the spinal cord. There are around 31 pairs of spinal nerves from neck till the lower back region, which innervate each and every part of the body. These spinal nerves, the nerves which are in blue color in the picture, these spinal nerves are not blood vessels. They don't carry blood. They carry signals from the brain. They are like cable wires. They innervate each and every part of the body. They take signals from the brain and send the signals to different parts of the body. They take signals from different parts of the body, send the signals to the brain. So these nerves are 31 pairs in number, and the place where the nerves are coming, the blue color nerves are coming, you can see the purple color disc. This is called intervertebral disc, that is present between 2 vertebrae. This intervertebral disc is actually like a cushion. It is also a part of a skeleton, but it is not a bone. It is cartilage. 80% of this particular intervertebral disc is filled with fluid, and this fluid helps us keep our posture straight. And whenever there is a compression, whenever we stand erect for longer duration, we lift some heavy weights, or we bend forward, or we travel on a jerky road, 2 bones, they tend to hit each other like this, and the disc in between acts like a shock absorber. The bone comes down and it tries to push it away and keep it in its own place. So this nice and beautiful mechanism has been designed by God so that we can do so many things. We can be flexible, we can bend in any way possible, we can do anything. using this wonderful mechanism called this spinal cord and the backbone. Unfortunately, in some people, the liquid inside this disc, it gets reduced. The cartilage gets degenerated. And because of this degeneration, this flexibility or the spring action or the cushioning action of the disc gets reduced. And when this gets reduced, this cushioning action is less or sometimes zero. And when there is a compression, when there is a jerky travel on the jerky road, or when you're bending forward, two bones tend to hit each other and the disc in between gets compressed. And sometimes when the compression is more, it comes out of its place. Just like when you take two slices of bread and put jam in between and press the bread, the jam comes out. Similarly, when two bones, they get when they hit each other, the disc in between, if it is not having enough liquid to lubricate, enough liquid to act as a cushion, it gets compressed, and when it is compressed more, it comes out of its place. And when it comes out of its place, if you look at the picture, normally the disc should be not touching the spinal cord, which is yellow and golden color. In the penultimate disc, the reddish color disc, it is getting compressed and it is coming out, and it is pressing the spinal cord. That, my dear friends, causes back pain, severe back pain. So the black hole in between the vertebra, this actually is supposed to be an animated picture, but somehow we are getting only the picture. So the black hole in the vertebra carries this spinal cord. When the blue color disc comes out of its place and crushes this spinal cord, then we have severe pain. So this particular, the red ring which is there, which is being shown, the blue color disc which is there, it compresses the spinal cord whenever there is pressure. So if you look at this picture, this is an actual picture of the spinal cord and the backbone. You can see a bone above and a bone below, and between, like a sandwich, there is this intervertebral disc. Unfortunately, the disc got compressed and it came out of its place. And on the right side, there is spinal cord, white color spinal cord, which is getting compressed by the disc which came out of its place. This crush, this compression is the reason behind the excruciating pain in the back. This is a MRI. If you look at this MRI on the left side, the white colored vertical line is the spinal cord. And on the left side, there are bones, and in between there are discs. And if you look at the last disc is black in color. The other discs are white in color, whereas the last disc is black in color. And it came out of its place and it is crushing the spinal cord. It is compressing the spinal cord. Other discs are there in their own places, but the disc, which is the last disc, it came out of its place. And if you look at the blackish discoloration, it indicates degeneration. There is no liquid inside the disc. There is no lubrication. There is no cushioning effect. Whenever there is pressure, the disc is coming out little by little and it is compressing the spinal cord completely. Similarly, in the right picture, the brain, and it extends below as the spinal cord, and the blue arrow is showing you the disc where the degeneration is there, and it is compressing the spinal cord and it is causing severe pain. As I've told you, there are 31 pairs of spinal nerves which are coming out of this backbone. And these spinal nerves are innervating each and every part of the body. Nerves coming out of the neck region, they are innervating the whole hand. Some nerves are going into the head. Some they will go into the eye, ears, and some nerves are going to the rib cages. Some nerves are going to the leg. From the lower back region, they are innervating the leg until they reach the fingers. So if you look at this nerve on the right picture, if you look at the nerves coming out of the spinal cord, a pair of nerves are coming out. On the left side, the nerve is getting compressed by the disc because of the disc degeneration. The disc came out and it is compressing the nerve, and this nerve, wherever it goes, it causes severe pain. So if you look at the picture, the red part on the left side, on the leg of this person, it indicates the nerve which is, it's showing the nerve which is getting compressed in the lower back region, and wherever this nerve is going, it is causing pain, severe pain, tingling sensation, burning sensation, pulling pain. So many nerves in the leg or in the neck region from the to the hand, they get compressed and they cause severe pain in the whole limbs. In this picture, you can see that the nerves from the neck region, they are getting compressed and they are causing pain in the whole hand. Sometimes they even cause pain in the head. Sometimes they cause dizziness. Sometimes they cause vomiting sensation in the person because of the compression. They can get severe headache. People think that there might be some problem in the brain or some sinusitis or something like that. No, because of the compression of the nerves which are innervating the head region, they start from the neck region, and the neck region they get compressed. There is severe compression on the nerves, and they are showing the symptoms wherever these nerves are going, whether it is in the hand, whether it is in the head, whether it is in the leg, wherever the nerves are going, you see severe pain, tingling sensation, burning sensation, pulling sensation, and so many other symptoms. So if you look at the disc on the top, the normal disc, it's the way it has to be. But when there is degeneration, slowly the disc loses the consistency, the liquid inside the disc gets reduced, and because of the pressure, it bulges out. The bulging disc which is shown, it bulges out, and sometimes the disc lining will get teared, and that there will be a tear in the disc lining, and the liquid inside the disc also will come out. The herniated disc which is shown in the picture. Then the disc becomes so thin, and after a period of point of time, even the bones also, they get degenerated. So these are different stages we see in a person who is having severe back pain. So normally, what do we do in this condition? Generally, we go to a doctor, and doctor will say that you are having some back pain. You get an X-ray or an MRI, and we go for an MRI or an X-ray, and then doctor says you have a disc problem. I think you have to take bed rest for 3 months, and whenever there is pain, take these painkillers and do some physiotherapy and exercises. This will help you in solving the problem. Unfortunately, doing exercises, taking bed rest, or taking some painkiller, all these things will not help in stopping the degeneration or starting the regeneration. So after some point of time, the degeneration will be severe, and the doctor will suggest go for surgery. So what surgery will we go for? There will be a specific, very complicated surgery called discectomy. Initially, doctors might do some laminectomy. They might remove only small part of the disc, but sometimes they have to remove the entire disc and replace it with a steel plate and fix some screws and bolts and nuts to the part. So what is wrong in it, you might say? See, our backbone is designed in such a way that it is completely flexible. Between every two bones, there is cartilage, so that there will be movement like this. You can move like this, you can move like this, you can bend like this, only because the backbone is flexible. But when you remove the disc and fix some screws and plates, both the bones will become one single bone, and your backbone will not allow you to be flexible. It will not allow you to bend forward, bend sideways. So, okay, some people will have so much of pain that they will just ignore it. Even if I'm not flexible, that's okay, but I have to get rid of this pain, and I'll get this surgery done. Unfortunately, this surgery is a very complicated surgery. When you cut this disc, sometimes the surgeon might cut the nerve which is coming out of that particular spinal cord. And if that happens, if any damage to the spinal nerve happens, there will be a permanent disability, paralysis of both the limbs or all the four limbs, or sometimes even there can be a danger to the life. It's a so life-threatening surgery. Opening the skull and doing surgery in the brain is much easier than the spinal surgery. But there are some really good surgeons who do surgery without any complications. Suppose there are no complications and surgery is successful, only that particular disc which came out has been removed, and you will not have any pressure on that particular disc because there is no disc. But that will solve the problem permanently? No, my dear friends. See, what happens is when there is a disc and we remove the disc, then there is no pressure there. Until now, that particular disc, which is normally the lost disc, takes all the pressure. Now you remove the disc, the next disc will take the pressure. There are so many discs. You can't remove each and every disc. And once the degeneration sets in, it's not like this degeneration is just there in the lower back region or the neck region or on particular disc or only two discs. Once the degeneration sets in, it can start anywhere. The cartilage is there in the shoulder, elbow joint, knee joint, hip joint, ankle joint, each and every joint, even the small joint like this finger joint. When there is a movement, there is cartilage. If the degeneration starts in one particular joint, it can spread to any part. And you can't go on removing, you can't go on replacing these discs, cartilage with artificial joints. So this is not the solution. This is not the permanent solution. So before understanding what is the permanent solution, we need to understand why this particular problem is happening. Particularly nowadays, we see people, very young people, whose age is even less than 20, coming to us with severe back pain. The youngest patient I treated with severe back pain, who was ready to go for surgery, was a girl studying 8th standard at 13 years of age. Why people are getting severe back pain and severe degeneration at such young age? What is the reason behind it? So, as I've told you, there is this cartilage degeneration. Why is this degeneration happening? What is the reason behind this degeneration? When we eat food, food contains wonderful micronutrients which will nourish each and every cell of our body. And these micronutrients, they help in tissue building. But if these micronutrients don't reach the skeletal system tends to get degenerated. Why are these micronutrients not reaching the skeletal system? I'm eating good food, you might say. You might be having good food. It might be having all the micronutrients essential to nourish your body, but still, sometimes these nutrients get obstructed. The mechanism which supplies these nutrients to each and every cell of the body gets disrupted. The chemical reactions, the metabolic reactions which will help in distribution of these micronutrients get disturbed by some toxins called free radicals. And these free radicals are the root cause of degeneration. These free radicals, they disturb the chemical reactions which are responsible for supplying the micronutrients, particularly to the skeletal system. So why these free radicals are happening? Why these free radicals are getting accumulated inside our body? You will be shocked to know that these free radicals are called endotoxins. Toxins which are not coming from outside. Toxins which we are manufacturing inside our own body because of our bad lifestyle. What? We are manufacturing toxins to damage our own body, to degenerate our own skeletal system. How funny is that? What is the reason? Because of the bad lifestyle. We are not eating in time. We are not sleeping in time. We are not getting up in time. We are not doing physical activity. We are not exposing our body to sunlight. We are exposing our body to pollution. Lots and lots of toxins. We are eating so many unhealthy food items. And we are also exposed to so many harmful drugs. And we are constantly under pressure, stress, anger, irritation. All these things together, put together, called a bad lifestyle, is the root cause of accumulation of crores and crores of free radicals inside our body, which are responsible for the degeneration of our skeletal system. Not just skeletal system, there are so many other problems. No, only because of this accumulation of free radicals, because our lifestyle is bad. So nowadays, lifestyle disorders are the major threat to the economy of any country. Lifestyle disorders are the major reason for morbidity of any nation. 70% of deaths in country like India are due to lifestyle disorders. What are lifestyle disorders? Lifestyle disorders which are happening to us because our lifestyle is bad. Kidney diseases, heart diseases, obesity, diabetes, autoimmune disorders, degenerative disorders, liver disorders. All these things, including the skeletal disorders, degeneration, are because of the bad lifestyle we are having. So what to do? How can we get rid of this thing? First and foremost thing is, first we have to correct the lifestyle. There is no other way. Even if you go for a best surgeon in the world, he will not be able to stop the degeneration happening in your body if you do not correct your lifestyle. So what do? We in our hospital, we don't allow the patient to go for surgery. We don't allow the patient to eat harmful painkillers, and we treat the patient in such a way that there will be no recurrence in the future. How do we do that? So we try to remove toxins or free radicals from each and every cell of the body through wonderful detoxification therapies called Vamana, Rechana. First two therapies of Panchakarma therapy. Panchakarma therapy is a wonderful gift of Ayurveda to the world. This Panchakarma therapy helps in regeneration of the cartilage in each and every part of the skeletal system. So this Vamana and Rechana help in removing toxins, free radicals from each and every cell of the body. We go to each and every cell, remove these toxins and eliminate them from the whole body so that the degeneration inside the body will stop. There will not be any further degeneration once you remove these free radicals and stop accumulation of free radicals. But already there is degeneration. Already there is severe degeneration. There is no liquid in the cartilage in some discs of the backbone. What do we do about that? We do some regenerative therapies. There are some wonderful regenerative therapies. The pictures you are looking at are only some of the external therapies we do. External therapies help in increasing the strength of the backbone, increasing the circulation, reducing the pain. But there are some internal therapies. These are all external therapies. There are some internal therapies which will help in regeneration of the body called Vasti, Nasyam. Especially the special therapy called Vasti, in which we use the special Vasti called Erandamuladi Vasti, which I'll explain later. Erandamuladi Vasti will help in regenerating the liquid inside the cartilage. Now you might ask me, is regeneration possible? Doctors say that once the degeneration sets in, you can't do anything. You have to remove this disc, you have to remove the joint and put an artificial joint. That is the only way, says doctors. Is regeneration possible? Unfortunately, we all got preconditioned by this society in a negative way that regeneration is not possible. But my dear friends, the good news is regeneration is possible. But why do we don't know about that? If regeneration is possible, when I say regeneration is possible, I'll tell you how it is possible. In our body, there are so many cells. Each and every cell takes birth, then it performs its functions, and then it dies. It happens to each and every cell of the body. Skin cells, they live only for 30 days. They take birth, they work, they die. Similarly, liver cells, they live only for 45 days. They take birth, they perform, they die. Similarly, blood cells, we all know 120 days. That is the reason why we donate blood and you regenerate your blood. You give blood and you regenerate your blood. Because the blood cells, they live for only 120 days. Similarly, the stomach wall lining, the mucous membrane, mucous cells, they live only for 5 days. Only 5 days. They take birth, work for 5 days, and they die. Similarly, the skeletal cells, they live for 90 days. The cells in our skeletal system, we think our body, is like what we call a statue fixed in time and space. No, it is like a flowing river. Body is like a flowing river. You can't step into the same water twice, says some philosopher. You can't step into the same water twice. These cells which are there today, they will not be present tomorrow. Continuously old cells are getting destroyed and new cells are getting regenerated. Suppose, imagine this building. This building is so dear to me, and after some 50 years, government says you have to demolish the building because the building is old. I don't want to demolish it. And after 50 years, the science is so developed that we can remove each and every brick and replace it with a super strong brick. So when I replace all the bricks, I got a new building in the same shape. So if you replace all the old cells with new cells, after 90 days, there are no old cells in my skeleton. So then you might ask, after 90 days, if you take an MRI, if you take an X-ray, then you should see that there is no degeneration. But unfortunately, it is not happening. Why? Imagine if you are removing the brick and replacing it with another weak brick. Then you are getting the same old building or much older building. Similarly, the body is trying to regenerate new cells, but the raw material for this production of new strong cells is not reaching it because of these free radicals. You are not giving the proper nourishment to these cells because you are not removing these toxins from the body. They are everywhere. They are prevailing everywhere. They are not allowing the body to regenerate itself. So all we do is to remove these free radicals and allow the body to heal itself, and body will definitely heal itself. Then why are we not informed about this particular thing? Why no one speaks about this regeneration? Why no one, no, as I've told you, we are collectively preconditioned that once this disc is degenerated, it's degenerated. You can't do anything about it. You have to go for surgery. There is no other way. No way you can regenerate your discs. This is what everyone is telling. And we got psychologically preconditioned, tuned. You know, when they train an elephant in Kerala, when the elephant is very small, very, very small, they tie it with a rope. And because it is very small, it is unable to free itself from this rope. And they train it continuously. And once this elephant becomes huge, Mother Gaja, it's so strong. If you tie it with chains to a huge tree, it is so strong that it can uproot the tree. But, my dear friends, but if you tie that huge elephant with the childhood rope, it will not move. Because it got preconditioned that if someone ties me with this particular rope, I will not be able to free myself. It got preconditioned. We all got preconditioned that degeneration is permanent. Regeneration is not possible. There is no way we can regenerate. Array, we got this wonderful science called Ayurveda and yoga. Both of them, they say that regeneration is possible, and now the whole world is saying regeneration is possible. Billions and billions of dollars are being spent on regenerative therapy research all over the world. Now the world is believing what Ayurveda told previously. Regeneration is possible. Now everyone knows each and every cell will live for only few days, and after that new cell will come. How can we make these new cells strong? Regenerative therapy research is happening right now all over the world, but Ayurveda already has a solution. Yoga already has a solution. So how do we do that? So we have some wonderful therapies called vastis. They help in regeneration of this cartilage. There are some wonderful vastis we use, like Erandamuladi vasti, Tiktakakshira vasti, Vaitarna vasti, specifically in disc problems, in back pain, in neck pain, which help in regenerating this cartilage inside the discs, not just in the particular disc where the degeneration has started in one particular disc. Every part inside our skeletal system, everywhere where there is cartilage, it will get strengthened with these vastis. And there is another vasti called Bhuhatyadiyapana vasti. And then we do some special therapy called Nasya Karma, which will stimulate the nervous system, which will directly, the medicine will directly enter the brain, and it will stimulate the whole nervous system, and it will strengthen each and every cell of the body. These are the third and fourth therapies. Previously, I spoke about Vamana and Virechana, which will help in removing the toxins and stopping the degeneration. This Vasti and Nasya Karma will help in regenerating each and every cell of the body. And then there is this wonderful therapy called Vahani Karma or Agni Karma. This is a therapy which is coming from the past 5,000 years, initially mentioned by Sushrutacharya. Vahani Karma or Agni Karma helps in fixing the discs in their own place. We have a wonderful instrument called Panchaloha Shalaka, and we transfer this thermal energy to those points where are special murmur points which are present on our spinal cord. We transfer the thermal energy in such a way that discs, they get fixed there. They will not come out of their place easily. So this Vahni Karma is a wonderful therapy. So all these therapies which I am telling you right now, this Panchakarma, Vamana Karma, Virajana Karma, Vasti, Nasya and Vahni Karma, all these things are those interventions which a doctor does. Let's say this is the one part of your treatment. What about the second part and third part? Only therapy will not help. The second part is sleeping in time, getting up in time, eating in time, eating the right food. And the third part is practicing yoga, pranayam, yoga asanas, and being physically active, and also keeping your mind in your own control, keeping maintaining mental peace, because the stress is the single most biggest reason for the accumulation of free radicals. So when you can do all these three things together, therapies, good lifestyle, and yoga and pranayam, that will help in solving your problem. So let us see what food is helping the regeneration of cartilage and discs and bone. You can eat more fruits, more dry fruits, soaked in water, milk, ghee, vegetables, all the vegetables, buttermilk. Freshly cooked food is always nourishing in nature. Sattvic food, millets, so many millets are available nowadays, dairy products, all these good sattvic foods are helping in regenerating your disc and cartilage. And those foods which are harmful, we are what we eat and we eat what we are. When we eat bad food, we turn unhealthy. And when we are unhealthy, we crave for bad food. That is a vicious circle. So we need to cut that circle somewhere. Eating fried food, spicy food, oily food, reheated foods, pickles, and potatoes is one thing which will increase the pain. Pumpkin also increases the pain. Jackfruit and banana also increases the pain, only for pain. Solid curd is not good. Well churned buttermilk is good. Tomato also increases pain. Non-vegetarian food will not help in regeneration. Cool drinks, chilled items, processed foods, preserved foods like jams, sauces, canned food, tinned food, and of course, food infested with pesticides and fertilizers, and refrigerated food. You cook the food, keep it in refrigerator, reheat it, and again eat it. You are inviting diseases into your own body. Doctors say that during the summer season, during the summer season, when you see that lots and lots of refrigerators are being sold, manufacturers of the refrigerators are so happy, sellers of the refrigerators are so happy, but more than them, doctors are very happy that they will get a lot of business. They say that if you have a big fridge in your house, you will have a big disease in your body. So don't put any cooked food in refrigerators and reheat it and eat it. That is the recipe for disaster. So how can we change our lifestyle so that we can regenerate our own backbone? You can sleep by 10 p.m. You can wake up at 5 a.m. Breakfast before 8 a.m. Lunch before 1 p.m. Dinner before 7:30 p.m. Avoid pollution. Do spinal exercises to strengthen our backbone and spinal cord. Regular pranayama and meditation. This helps in regeneration of cartilage and bones. This has been proved beyond doubt that pranayama and meditation will help in regeneration of new cells inside your skeletal system. This has been proved beyond doubt. So we need to prioritize life. Prioritizing life. What is very important for me? For me right now, health is very important. My relationships are very important. Career comes later. So how can I prioritize my life so that I can reduce my stress and anxiety and tension? These are the reasons for accumulation of free radicals. We can avoid foods grown using pesticides and fertilizers. Of course, we can help others. When we help others, automatically help comes towards us in various forms. We take social responsibility. We help others. We take others' problems out, and our problems will also get solved. So these are some simple lifestyle changes we can apply in our own body, in our own lifestyle. And of course, there are some simple precautions like observing the right posture, So always when you sit or stand, observe yourself, observe your body, how your body is responding. Is it strong? Is it weak? Is it trying to always stoop forward? Or you are able to stand straight? You are able to keep your posture wonderfully. Observe your posture. And we all know that when you use mobile a lot, you are damaging your cervical spine like anything. So it's very, very important for us to minimize the usage of mobile. And whenever you have to use for a longer period, like then you hold it like this, not like this. And people who sit before the computer for longer durations, you have to ensure that the angle between your trunk and your thighs is always 90 degrees or more than 90 degrees, but never less than 90 degrees. Similarly, the angle at your knee joint is always 90 degrees or more than 90 degrees, but never less than 90 degrees. You should not fold your legs inside your chair. You can put it on the footrest of your table. Similarly, your monitor should always be at your eye level, not like this, at your eye level. Your keyboard, when you keep your hand on your table, it should be like this, not like this or not like this. The angle here, it should be always be 180 degrees like this. So these are some of the important things. People who use computers a lot, they have to keep these things in your mind. If you have some disc problems, if you have disc problem, then you should not bend your back to lift something or to pick up something. You should always bend your knees, sit down and pick up something. Definitely not bending your back when your back is weak and when your disc is coming out of its on place always. So sitting and sleeping and reading a book like this, or keeping your laptop on your chest and you using it like that while sleeping. And there are so many other wrong postures which people follow. We need to correct our postures. Of course, Kishore Garu has demonstrated all the asanas useful in strengthening our backbone. Bhujangasana, Shalabhasana, Dhanurasana, Marjalasana, Ustrasana, and so many other asanas are there. Initially, we advise when the pain is severe, we say that only go for asanas where there is only backward bending. Once the back gets strengthened, then we can also do forward bending, but not as much as you do the backward bending. So initially, when your spine is delicate, do more of backward bending. You can do spinal twisting, all the asanas which will help in twisting your spine. All those things are good. Of course, there are some simple exercises which are nothing but a stylized way of showing our asanas, like Bhujangasana and the Shalabhasana. And this is like a Hanuman pose. Okay, so Naukasana and Dhanurasana, all these things. And of course, to strengthen your neck, we all know how to move our neck in various ways, like this way, forward, backward, and rotating completely. All these things will help, and only you have to do when the pain is not severe. You start with very, very simple movements, and once your neck gets strengthened, you can flex freely, you can flex your neck. When you have severe neck pain, then you do only static exercises, like you press your forehead with both your hands like this and press your head from the backwards. Similarly, on one side you press it and another side you press it. You should press it, but you should not bend. You should stop your hand with your head like this. So then we, there are various strengthening exercises which will strengthen all the neck region muscles, and we can do all these things. This is the thing which I've been telling you about. These are static exercises. Of course, waist rotation, hip rotation, spinal stretch to the sides, forward and backward stretch, dorsal twist. All these are nothing but simple asanas. So all these things will help you in strengthening your back, and panchakarma and good food and pranayam and meditation will help you in regenerating your discs. And we have successfully treated more than 9,000 patients in the past 18 years. And not even a single patient underwent surgery after undergoing these therapies. So this is my assurance. You don't need to have any surgery for your disc problems in any particular point of time. And I would like to close this session with one more important problem which affects our spinal cord, that is ankylosing spondylitis. Ankylosing spondylitis is a different condition where you can see in the picture in the bottom part, the bones, two bones are fusing. They are getting fused into one single bone. It happens when two bones slowly grow and become one single bone, and the entire bone becomes one single bone. Instead of being a flexible chain, it becomes a single straight bamboo spine. This is a very, very difficult disease to treat, and it is called an autoimmune disease. Our immunity is attacking our own backbone, and it is causing this dreadful disease called ankylosing spondylitis. Our bone is becoming very hard and rigid, and there is no flexibility at all. You can see this is a healthy spine. Then slowly the inflammation starts, and slowly bones fuse and they become a single bone. And these are the symptoms people experience when they have ankylosing spondylitis: lower back pain and stiffness, hip pain, joint pains, neck pain, and difficulty in breathing, because the ribs also they get affected. These ribs also they become ankylosed, and there is no movement like this. Lung movement will be affected, and there will be very severe breathlessness because of ankylosis. Fatigue, loss of appetite, unexplained weight loss, abdominal pain, diarrhea, skin rash, vision problems. Many people, they come to us saying, complaining that they have back pain, but when we diagnose them, they have this severe problem called ankylosing spondylitis. So difficult to treat, but the good news is we have solution. Ayurveda and yoga is having solution for this dreadful disease, where allopathic doctors say there is no other way except using steroids. See, you can see that there is inflammation in the joints, and slowly the bones, they are getting eroded. And then there is this syndesmophytes forming, and they're slowly fusing, and the entire backbone fuses and becomes one single bone, which is so dangerous. So what are the other complications of ankylosing spondylitis? Vertebrae, they get fused, it is called ankylosis. Kyphosis is called curvature of spine. They become like this, bending forward, and the posture gets fixed. Osteoporosis is seen. And even this inflammation affects these eyes. There is inflammation in this iris and uveitis, painful inflammation, severe pain in the eyes, photophobia, sensitivity to light, and even the heart, the aortas, there is inflammation and they become very big, and the wall has a problem and the blood leaks backwards. There is arrhythmia, aortitis, cardiomyopathy, and then chest pain, breathing gets affected. There is sometimes the jaw also gets affected. Jaw inflammation is there. Cauda equina syndrome, where the nerves get scarred and inflamed. Even the nerves get affected. These are the complications of ankylosing spondylitis. And what is the reason for this dreadful ankylosing spondylitis? There is a gene called human leukocyte antigen. And when you do some blood test, if this HLA-B27 test is positive, it says that you have that protein on your white blood cells, which is affecting your immune system, which is promoting, which is irritating the immune system, and immune system is attacking the joints, and the joints are responding by ankylosing themselves. But the problem is, there are so many people, 80% of the people who have this HLA-B27 in their blood are not getting this ankylosing spondylitis. Only 20% people who are having this HLA-B27 in their blood are getting this ankylosing spondylitis. What is the reason for that? The reason behind this is these people are allowing the immune system to attack their own body by changing the lifestyle, by following a worst lifestyle. With the bad lifestyle, with the accumulation of free radicals, these immune cells are getting irritated, and already there is HLA-B27 protein on the white blood cells, and it is directly attacking. So a combination of this altered gene and bad lifestyle is the main reason for this ankylosing spondylitis, which is becoming more and more common nowadays. So what is actually autoimmunity? We know the border security force which is there, it is supposed to protect our country from the terrorist invasion or the Pakistan army invasion. But when some soldiers, they come and attack our own Indians, that is called autoimmunity. The white blood cells which are supposed to help us from the invasions of bacteria, viruses and funguses, They should kill the bacteria, kill the viruses, kill the microorganisms, and they should help us. But instead of doing that, what they are doing, they are attacking our own joints, our own body, not just the backbone. They are attacking so many parts of the body. You know, wherever they attack, they tend to damage or destroy the tissues, that alter the organ growth, they alter the organ function. So there are more than 100 types of autoimmune diseases where ankylosing spondylitis is one particular disease. There is another disease which affects the bones, that is rheumatoid arthritis. So there are so many other diseases which affect the brain, blood, GI tract, nerves, lungs, skin. 100 plus autoimmune disorders are there. And the reason is bad lifestyle, my dear friends, bad lifestyle. So all we have to do is correct our lifestyle. If you don't do that, you will not be able to solve this problem. Allopathic system, they prescribe steroids like prednisolone to suppress the immune system. Immune system is what is the immune system doing? It is attacking our own body. So what will we do? We'll suppress the immune system. What will happen if you suppress the immune system? You will be prone to all the infections. When you suppress the immune system, you will be making your all organs vulnerable. Your liver get affected, your kidneys might get affected. Any part of the body, vital parts of the body will get affected when you are on constant supply of steroids. Immunosuppressants will damage the body like anything, but there is no other alternative in allopathic system except immunosuppressants to treat autoimmune disorders like ankylosing spondylitis. So what can we do? We can definitely help you understand why this thing is happening. As I've told you already, this stress and bad lifestyle are the reasons for the accumulation of free radicals and reasons for the autoimmunity. So we need to correct it. We need to correct our ahara. We need to correct our vihara, our lifestyle. We need to treat our sarira and we need to treat our manas also. Not just treating our body is enough. We need to treat our mind also. We need to understand that we are not just our own body. Our body is there. Apart from body, I am also there. This is very important thing, my dear friends. I am there and I'm using my body as my tool. So I need treatment and my body also needs treatment. We in Ayurveda, we do Panchakarma therapy, Panchagavya therapy, Rasayana therapy. We give some herbs and minerals to modify the immune system so that immune system will not attack our body. Immune system helps our body. We modify the ahara, we modify the vihara of the body. But to do that, we need to understand that we are not just our own body. I say that my shirt, my spectacles, my hand, my face, who is this my? Who is me? I am completely different from my body. My body is just my tool. And I need to take care of my body so that I will understand my life's purpose and reach my life's goal with the help of this wonderful tool called this body. But unfortunately, we don't differentiate ourselves from body. We think we are our own body. We don't think that we are different from our body. Body is different. I am different. My needs are different. My body's needs are different. My needs are food. My needs are, I have some, my body's needs are very different. Like I need protection. I need, proper nourishment. I need tools for proper utilization of the body. I need nourishment. I need food, water, air, sunlight. I need protection. I need clothes, home, slippers and shoes, etc. I need tools for proper utilization of the body. Like I'm using this computer, I'm using these spectacles, I'm using this mic, I'm using all these things so that I need not strain my body. So all these things, protection and nourishment and right utilization tools, all are the needs of my body. I don't need these tools. My body needs these tools. Unfortunately, when I think that I am my own body, I try to get happiness from these tools. Actually, I need happiness, but I don't know where this happiness will come from. I think I am my body, and because my body needs food, I try to get happiness from my food. How do I do that? I eat unhealthy food. I get addicted to food and I get happiness from food. I think I want continuous happiness. I'm not getting continuous happiness from food. Then I go for another thing. I think I use a mobile phone to communicate with other people, but I think I get happiness from my mobile phone. I continuously try to extract happiness from my mobile phone. I get addicted to my mobile phone or my TV or my laptop or any of these gadgets, and continuously I over abuse my body, and that is the reason for all these ill healths. When I understand that body is a material unit, and material units follow the laws of nature, and body follows the instructions of ourself, I use my body like a tool. Whatever I tell, my body obeys. If I give it good food, it gets nourished. If I give it bad food, it gets degenerated. Whatever is there, it is in me. I have right understanding, I will use my body in a proper way. If I don't have right understanding, I will use my body in a wrong way. I have to understand. For that, I need to understand the language of communication with my body. Body always sends me signals. Body tells me that so and so thing is happening in your spine, so and so thing is happening in your digestive system, so and so thing is happening in your nervous system. Body is trying to tell you. Even the smallest change in your body is being communicated to you in the form of wonderful signals. But unfortunately, no one taught us how to communicate with our own body. How do we communicate with our own body? How do we understand what body is trying to tell us? We observe, we communicate, we interact with our own body, we comprehend what body is trying to tell, and we reciprocate with the right action. So what do we observe? We observe a breath pattern. Are we doing the right way of breathing? Are we breathing deeply or only shallow breathing? Are we breathing through your nose or are we breathing through your mouth? Are we doing the diaphragmatic breathing or are we only breathing till the neck? What are we doing? How is a breath pattern? If your breath pattern is not proper, you will be under immense stress because of lack of supply to the supply of oxygen to the brain. Correct your breath pattern, you will instantly come out of your stress. Always, if you observe when you are under stress, your breathing will become shallow. When you make your breath pattern very deep, immediately you will switch from the mood of depression to the mood of happiness. Observe your hunger, observe your thirst, observe your body is strong or weak, observe your flexibility or rigidity of your joints, whether you are able to withstand strain, whether you're able to withstand the change in temperature, change in weather. All these things will tell you whether the body is healthy or not. Observe yourself, how yourself is feeling. Are you feeling enthusiastic or lethargic? How are you reacting to the stress? How are you reacting to various challenges? Are you facing them or are you running away from them? Are you feeling prosperity or deprivation? Are you feeling trust or fear? Superiority or inferiority or equality? All these things. And of course, there is this cleansing of 5 sense organs. All these things, we actually make it a routine for all our inpatients in our hospital. Oral hygiene, nasal hygiene, eye hygiene, ear hygiene, skin hygiene, cleansing each and every part of the body, each and every moment, every day. We need to cleanse each and every part of the body. How do we do that? And doing proper physical labor. Doing exercise is different, doing physical labor is different. And then playing with kids, exposing the body to sunlight, doing Surya Namaskar, yogasanas, and doing pranayam, meditation. This helps in strengthening the self. Practicing silence, practicing non-judgment, practicing awareness, spiritual practices, practicing affirmations, visualizations, reading regularly reading good books, and keeping personal goals, and nourishing the body. Observing the mind and body before eating your food. If you are full of stress, anger, irritation just before eating food, the food you eat will not nourish your body. Planning the right food, eating in the right time, and doing Vajrasana after eating food, not sleeping immediately after food, all some points. And similarly, ergonomics. How do you strengthen your eyes when you are constantly exposing yourself to the computer? How do you care your spinal cord? Not sitting erect for longer duration, not sitting continuously for longer duration, taking a break every 45 minutes, stretching your body and coming back to your place and doing work, changing the postures. Observing proper ventilation at workplace. If your workplace is not getting sufficient supply of oxygen, you are degenerating your cells. And planning the work in a right way so that you will not spend more time before the computer or before your work. And of course, strengthening your relationship is very important. Doing some activities with your family members, spending quality time with your family members, playing and creative activities, sharing your household responsibilities, discussing the whole day activities with your spouse, with your kids, with your parents, planning all these things together, story time, and sitting together and having food and doing yogasanas together. All these things will help. And of course, proper rest, switching off lights at 9:30 p.m. That will help in production of melatonin, which will help in regeneration of the body. Proper ventilation in the bedroom. If you close all your windows and only take the AC thing, you are not getting fresh supply of oxygen. You are degenerating your skeleton system. Of course, if you don't get proper sleep, having foot massage, head massage just before sleep, sleeping before 10 p.m. And if you don't get sleep properly, doing meditation to induce sleep, all this will help. So all these things which I've mentioned right now, we made a wonderful tool called Health Tracker. I have given some around 60 activities which you can do whole day without disturbing our own regular work. All these activities, when you do them, you tick. When you don't do them, you put an into mark. So whatever I have told you till now, all these activities are there in this health tracker. So we teach our patients how to use this health tracker. When you do pranayam, you make a tick mark. When you do yogasanas, you make a tick mark. When you do meditation, you make a tick mark. When you are observing your body and mind before having food, you make a tick mark. Like that, you use the entire health tracker. And for 14 days, if you practice and try to do maximum tasks out of this health tracker, I can say within 14 days, you will see wonderful change in your health. Wonderful change. So you can actually utilize this health tracker. I will share this health tracker with you people. You can actually use this health tracker. All these things are very, very simple things. You don't need a lot of time to do. Maybe more than 1 hour more than what you are doing every day. Just 1 hour every day. 5 minutes, 2 minutes activities every day in regular intervals. That will help you keep yourself consistently aware of what's happening inside your body. Body will tell you and you will understand. You will understand the language of your own body. That is the one thing which will help in regenerating our own body. So this whole thing which I'm telling you till now is a small part of the syllabus we have prepared called Holistic Human Health for All India Council for Technical Education. I'm the convener of the health committee, health syllabus committee, and we prepared this syllabus called Holistic Human Health for all the engineering students. And from next year onwards, first year engineering students will undergo this training called Holistic Human Health during the student induction program. So, and luckily UGC is also becoming a part of this wonderful initiative, and maybe in future all the UGC graduation colleges also will get this syllabus, and it will become a compulsory education process for all of us, because nowadays everyone wants to stay healthy and everyone takes the help of YouTube, WhatsApp to stay healthy. We get lots and lots of information. Eat this food, they drink this kashayam, do this regimen. But unfortunately, these are all half-baked truths. When you try to apply these things experimentally, sometimes they work, sometimes they don't, because we need to understand the principles, health principles behind all these tips and guidelines. Once you understand the principles, you can apply them in your own life. You can design your own healthy lifestyle according to the health principles. And that is what we are trying to teach in this Holistic Human Health workshop. So I'm so happy for all of you. You have listened to this whole session so patiently. I thank you so much. I invite you to our Yagyadev Ayurveda Research Institute located in Visakhapatnam, where we conduct regular health workshops, yoga and Ayurveda workshops. And we have 3-day workshops. Free of cost, we do these workshops and we teach. We make you understand and apply these health principles so that you follow a better lifestyle. We also do 10-day yoga and Ayurveda workshops. Whenever we have, we will send all the information to Kishore Garu so that you will all be notified. And I hope this session will has created awareness about the spinal health and also the overall health of body and mind. And I request all of you to commit yourself for a better lifestyle from today. And I request all of you to give some time for yoga practice, give some time for healthy body and mind, and give some time for planning your diet properly, eat sattvic food, be good, be strong, and try to build a healthy society. Thank you so much.
Namaste, sir.
Namaste.
Sir, sir, can you allow us a few questions?
Yes, madam. Definitely.
Namaste, Permadu, sir.
Namaste, namaste. Am I audible?
Can we take few questions?
Yeah, I can take few questions. I'm also looking at the chat window for the questions.
Yes, yes.
Someone has asked, what is the fastest way to relieve the back pain? Kurukula, Chandrasekhar. Yes. So there is no fastest way. Maybe backward stretching will give you instant relief from back pain, but that will not be a permanent solution. As I've told you, once the degeneration sets in, you have to reverse that process. What is the most common cause of back pain? Most common cause, as I've told you, is the bad lifestyle and undernourishment of the skeletal system. Someone asked, where is Dr. Sundaraj Perumal's clinic? It is in Visakhapatnam. Someone has answered also. Yeah. So please share the health tracker soft copy in WhatsApp group. Definitely we'll share the health tracker soft copy. And
sir, namaste,
yes.
sir.
Namaste.
This is Sunita.
Yeah.
Sir, one more thing I just want to know, like, on the vertebral column,
yes.
spine mida, manaki osteophytes and cheppi vastayi kada, sir.
Yes.
Because one causes because of age.
Yes.
And how to reduce this osteophytes and on the spine, and what are the side effects of it, sir?
See, osteophytes are happening because initially there is erosion of the bone, and then slowly bone tries to grow back, but not in a right way. It becomes thorny, and small nodules like things will appear, and these are called osteophytes. It indicates degeneration in the backbone, bone, wherever the bone it is. So this degeneration is indicating that there is no proper nourishment to the skeletal system. When we give proper nourishment back, and when we remove the obstructions like free radicals, then body naturally dissolves these osteophytes and grows the normal bone strongly. It happens naturally. We need not do anything. Of course, when there is a overgrowth of bone, sometimes we need to take help of certain medicines which will help in giving the normal shape and removing the excess bone growth. There are some certain medicines like Lakshadri Guglu and Vridhivadikavati, but normally body itself will take care of these extra growths, and it will dissolve them by itself if we allow to do it. If we create the proper favorable environment for the body to heal itself, that will happen naturally. We need not do anything.
We have few raised hands. I would like to invite Pavan Kumar Garu, please unmute yourself.
Yes, namaste madam. Namaste sir.
Namaste Pavan Kumar Garu.
Sir, బాగా ఎక్స్ప్లెయిన్ బాగా చేశారు సార్. వెరీ గుడ్. అన్ని బాగానే ఉన్నాయి సార్ మన దేశంలో, కానీ ఫాలోయింగ్ లేదు సార్. ఎకనామికల్ బ్లాక్ మనీ ఆఫ్ ఇంట్రెస్టింగ్ లివింగ్ లైఫ్ ఒకటి, తర్వాత మనము ఇవన్నీ బాగానే ఉన్నాయి, చెప్పుకోవడానికి బాగానే ఉన్నాయి, ఆచరించడానికి ఎవరు ఆచరణ లేదు సార్. అన్ని వెరీ గుడ్ ఎక్స్ప్లెనేషన్, అన్ని బాగుంది, ప్రాక్టికల్ గా అన్ని ఓకే మనం అన్ని, కానీ లివింగ్ లైఫ్ లో అది మార్పు రావాలి సార్. అది రావాలంటే మనం అందరూ ఎకనామిక్ ఓరియంటెడ్ చూస్తున్నాం సార్. మనీ ఓరియంటెడ్ ఏ పని చేసినా మనీ మైండెడ్, మెయిన్ సిటీ లైఫ్ వదులుకోవాలి సార్. బ్లాక్ మనీ ఆఫ్ ఇంట్రెస్ట్ లివింగ్ లైఫ్ మెయిన్, వే ఆఫ్ లివింగ్ లైఫ్ లో ఎవరు కానీ ఎక్సైజ్ చేయడం సార్.
ట్రూ పవన్ గారు, what you told is very true, but we can start with our own family. We can start with our own people who are with us, around us, mana friends, mana family, mana వీళ్ళందరితో మనం we can start. మనము we can be an example for our family, we can be an example for all our peer group, our relatives, our close friends. We can be a role model. We need role models right now. We need people who actually walk the talk, who actually implement all these things, who actually follow a good lifestyle. అండ్ నన్ను చూసి నా చుట్టుపక్కల వాళ్ళందరూ కూడా ఇన్స్పైర్ అవ్వాలి. నేను మంచి లైఫ్ స్టైల్ మెయింటైన్ చేయాలి, నేను చాలా హెల్తీగా ఉన్నప్పుడు అందరూ కూడా ఎలాగ నువ్వు ఎంత హెల్తీగా ఉన్నావు అని అడిగినప్పుడు ఇలా రండి, నేను మీకు హెల్ప్ చేస్తాను, ఐ విల్ బి యువర్ కోచ్, ఐ విల్ బి యువర్ రోల్ మోడల్, నాతో పాటు చేయండి అని అలా ప్రతి వాడు చేయబట్టుకుని ఇంకొకరిని నడిపిస్తే అలా దెన్ స్లోలీ ఆర్ డ్రీమ్ ఆఫ్ బిల్డింగ్ ఏ స్ట్రాంగ్ హెల్తీ సొసైటీ విల్ కమ్ ట్రూ అండి.
సార్ వన్ థింగ్ సార్, మనం పొలిటికల్ సైన్స్ లో మార్క్ తీసుకున్నాం సార్. పొలిటికల్ రాజకీయ నాయకులు మెయిన్ ఈ బ్లాక్ మనీ ఇంట్రెస్ట్, మనకు ఫిజికల్ సిస్టమ్ లిమిట్ ఉంది. మనము భోజనం చేసినా కానీ ఎనీథింగ్ దట్ లిమిట్, హార్ట్ బీట్ కానీ రెస్పిరేషన్ కానీ, అది మన న్యాచురల్ గా బర్త్ లో వచ్చింది, మన ఆప్టిట్యూడ్ బేస్డ్ ఆన్. అది హెల్తీ మెన్ కు ఎట్లా వచ్చింది అట్లా వచ్చింది. అట్లా మారి మన సిస్టమ్ ఉండాలి సార్. రాజ్యాంగం కానీ మన యొక్క ఎకనామిక్ సిస్టమ్ కానీ మెరిట్ సిస్టమ్ కానీ అట్లా ఉంటే మనకి త్వరగా మార్పు వస్తుంది సార్. అవి తీసుకొచ్చేందుకు మనం ప్రయత్నం చేద్దాం సార్. ఇవన్నీ బాగానే ఉన్నాయి సార్, వెరీ గుడ్. అందరూ ఒకటి ఆల్ సిమినార్స్ అన్ని బాగానే ఉన్నాయి సార్. కానీ మనకు ఈ బ్లాక్ మనీకి లిమిట్ లేకపోవడము, ఆ నగరీకరణ ఎక్కువ అవ్వడం, సిటీస్ లైఫ్ ఎక్కువ, ఇవన్నీ సార్.
పవన్ గారు ప్లీజ్,
ఓకే ఓకే
can you please listen to us?
ఓకే.
Sir, thank you very much for your questions, but I mean, due to lack of time, we are limiting the response.
Okay, madam. Okay, madam. Thank you, madam.
Kavita garu, to please unmute yourself and ask a question.
Wait a second, Kavita madam. Please unmute, madam. Please unmute.
Okay, sir.
Yeah.
Namaste, sir. I'm Kavita, sir, producer from EMRC, Usmania
Namaste.
University.
Namaste.
Sir, the description was very nice, sir, and it is very interesting. And this is very valuable for this current generation, sir. And whatever the food is suggested, actually, what should be avoided, that food nowadays we are preferring, sir, actually. So, yeah, that is the main problem for this. And, sir, I just want to discuss my personal problem, what my father is facing, sir. My father is 75 years old. And since for the past 50 years, he's suffering with spinal, like spondylosis. So that time also, he never gone for any allopathy medicine, or only with yoga, he's controlling his pain. But last 4 years back, he met with a small accident, like bike rammed into him while cycling. So there was a gap in between the spinal cord, sir. So some doctors are suggesting for the surgery, but my dad don't want to go for the surgery. So he is controlling right now with some yoga, but not complete with the body yoga, with like legs yoga and head yoga. So I did, what do you suggest, sir, so that I can follow and I can help my dad?
We suggest practicing pranayama rigorously. So particularly practicing more and more kumbhaka. So that will stimulate the regeneration of cartilage. Of course, if there is a possibility of getting this Basti karma done at a nearby place, Basti is a therapy which will help in regenerating the cartilage. So combination of Basti and pranayama works wonders even in elderly people. We have treated the patient, eldest patient we have treated with severe disc problem is 94 years old patient. And the youngest patient we have treated is 13 years old girl. So I can say with confidence that even at the age of 75 years, regeneration is possible. And already your father is practicing yoga. So with yoga, if we can undergo Vasti also, that will help in a wonderful way.
Definitely, sir. Thank you so much, sir. And thank you, Kishore sir and Nunali madam, for this such a wonderful session. And thank you so much, sir. Thank you, Sundar sir. Thank you.
Namaste.
Yeah. Lakshmi garu, kindly unmute your audio, please, and video also. Lakshmi garu, unmute, please. You please ask. Unmute your audio, please. Yes, you can ask.
నమస్తే అండి.
నమస్తే.
నమస్తే మహోదయ. నాకు 1 month బ్యాక్ నడుము నొప్పి వచ్చిందండి. అది మందులు వాడుతున్నా తగ్గట్లేదు. బ్యాక్ పెయిన్, అది కాల్ లాగడము, నడుము నొప్పి అలా వస్తుందండి ఎక్కువ. దానికి ఏం చేయాలంట?
అదే నడుము నొప్పి బేసిక్ గా ఒకవేళ డిజనరేటివ్ డిసీజ్ వల్ల అయి ఉంటే కనుక జనరల్ గా ఇనిషియల్ గా మజిల్ స్ప్రెయిన్ వల్ల గాను కొంచెం కంట్రాక్షన్స్ వల్ల కానీ కావచ్చు. అది కొంత రెగ్యులర్ గా ఆయిల్ మసాజ్ చేసుకుని కొంచెం బ్యాక్ స్ట్రెచింగ్ చేస్తే తగ్గిపోతుంది. అలా చేసినా కూడా తగ్గట్లేదు, కన్సిస్టెంట్ గా ఉన్నది అంటే కనుక ఖచ్చితంగా దగ్గరలో ఉన్నటువంటి డాక్టర్ని కాంటాక్ట్ చేయాలి. ఒక సివియర్ అంటే ఒక ఎక్స్రేలో కనుక డిజనరేషన్ ఎక్కువగా ఉందనుకుంటే కనుక అప్పుడు ఈ పంచకర్మ థెరపీ అండ్ యోగా ప్రాణాయామం కలిపి చేస్తే అది తగ్గుతుంది అనమాట. ఇనీషియల్ స్టేజెస్ లో ఉంటే ఓన్లీ సింపుల్ మెడిసిన్స్ అండ్ యోగాతో సరిపోతుంది. బాగా సివియర్ గా ఉంటే కనుక పంచకర్మ తీసుకోవాల్సిన అవసరం ఉంటుంది.
లక్ష్మి గారు, మీరు ఎక్కడి నుంచి అమ్మా?
మాది రాజమండ్రి నుంచి అండి.
ఓకే అండి, థ్యాంక్ యూ. Yeah, Bhagya madam, kindly unmute, please. Sorry.
Namaste, sir.
Namaste.
This is Bhagya. Sir, thank you very much, Professor Sundar Raj Perumal Garu. It's a very excellent and wonderful lecture, sir, about strengthen your spine and erase pain. And you focused different reasons. Nowadays, many people are suffering with spine pain, sir. So you focused on the reasons for pain and the suffering journey from healthy to degenerated disc. And you spoke about you given modern solutions to back pain and free radicals root cause of degeneration and very important of micronutrients essential to nourish our body. And you focused the eating unhealthy food items, how to strengthen and through the unhealthy food items, the impact, the stress, anger and irritation and free radical accumulations. And you enlighten what are the lifestyle disorders. So through lifestyle management and different problems, different diseases, kidney, diabetes, and you focused the holistic solution for back pain and neck pain. And most of the persons are suffering these pains. So it's very interested and useful, valuable lecture, sir. And you spoke about the importance of the cellular detoxification and Vamana and Rechana degeneration and stop the accumulation of free radicals. And you given a wonderful lecture, sir. And you introduced the lifestyle changes and bad lifestyle effect and the importance of ankylosing spondylitis. And you focused about the HLA-B27 and the real causes of autoimmune diseases and the conventional treatment and the total the management of Ayurveda and the immunomodulatory therapy, sir. I thank the department organizers, Professor Munalni Madam and Ramakrishna sir. So it's very useful and excellent lecture, sir. And the backbone of success is hard work and determination, good planning and perseverance. And according to the William Booker, the individual activity of one man with a backbone will do more than 1,000 men with a mere wishbone. So thank you, sir. Thank you very much for your excellent speech. Thank you.
Hello. Sir, once again, I want to thank on behalf of the organizers and myself for a wonderful presentation and a very lucid, and it's so clearly understandable to everybody. And it's really from bottom of my heart, I would like to put on record my thanks and also my acknowledgement to you and my gratitude to you to serve the nation, to relieve from this huge pain which many people, right from youth to that of old, everybody is suffering, including people like us sitting for a long before the computer. Also, we are facing this kind of an issue. I think with your suggestions and wonderful capsules of, kind of remedies that you have given, I believe it would really go a long way for all of us. We definitely take your help in organizing a 3-day, as you said, it is a free workshop. Pull the people. There are so many people who are suffering. We can pull them and request you to organize such program with us, sir. Thank you so much. And before closing, I wanted to ask one of my colleague at EMRC, very young girl. She's last 2 months, she is not coming to office because of this back pain. I want her to share her problem with you, sir. Few minutes if you can share. Thank you so much.
Definitely.
Yeah, I think some more two people are asking. Yeah, Sandhya garu, just ask.
Sir, namaskaram, sir.
Namaste.
Sir, thank you so much for a wonderful session, sir. Firstly, and from past 3 months, sir, I was suffering from neck pain, shoulder pain, all the shoulder pain, backside, and then also I had a little chest pain, and I was also exposed to a lot of anxiety. I was unable to take the sounds of even the children's playing around me. So I was facing this, and I have been taking treatment. Allopathy, I was like, when I use the medicines of allopathy, I was like, my body feels heavy, sir. like some liquid is getting inside, or I don't know. And then from past 3 to 4 days, I've started homeopathic treatment, sir. And I would like to know if any tests are needed to visit your institute, sir, before coming to your institute.
Yeah. Apart from other symptoms, you told this one symptom called you are unable to, withstand the sounds and noises.
Yes.
Right?
Yes, sir.
So this
Yes.
is called a sabda sahishnuta, and it is a symptom of rasadhatu. Rasadhatu is the one of the tissues, plasma tissue, degenerated. When there is a degeneration in the rasadhatu, you get sabda asahishnuta. Sabda asahishnuta. You can't, you'll not be able to listen or take higher pitch sounds and other things. So this sabda asahishnuta is a clear indication of degeneration. You need to get an MRI or X-ray, which will show us the level of degeneration. And I can assure you that this problem can be solved very easily within no time, provided you commit yourself for a healthy lifestyle. Okay. Even after solving this problem also, you need to continue this good lifestyle, eating in time, sleeping in time, getting up in time, doing yoga and pranayama every day, and eating good food. That will solve the problem forever. Okay. I can assure you that anyone with this problem, they can happily get back to the normalcy. Even the MRI will also show that there is no disc problem after the therapy and pranayam, continuous practice of pranayam. The regeneration is visible in the MRI and X-rays after the therapy. So
I actually took an MRI. It showed C4, 5, and 6 are affected, and there is a degeneration of 2 discs at those spaces, sir.
If possible, contact the nearest Panchakarma center, or you can get admitted in our own hospital in Visakhapatnam. It's a very serene place. You have seen the picture of this place, surrounded by hills and a nice goshala and organic farming. You're always welcome to our place, or the nearest wherever you are comfortable, you go and undergo the Panchakarma therapy along with yoga and pranayama.
Okay, sir. Thank you.
Welcome. Actually, sir, there are some more questions are there, but I request the participators, if you have any questions, you please just chat me. You can chat in the Zoom, or you can send your question through WhatsApp, my WhatsApp. Then I will pass on to the Dr. Sundarraj Perumal sir, and you will get answers. Okay. So thank you very much, sir. Once again, heartful thanks to Dr. Sundarraj Perumal garu. The thing is, in Andhra Pradesh, in our Telugu states, like you, there is a really service-oriented and highly expert personalities are there. That itself we feel as proud. And it's my humble request, if possible, with this what I say, University College of Education, and jointly we can organize some of the programs like this by that what Madam said, workshop, conducting the workshop, which are very much helpful to pass awareness towards this problem, especially spondylosis problems. So our expectation is our family members are mostly from B.Ed and M.Ed colleges of the Telangana state, and all the teacher educators and student teachers may get awareness. So in very soon in future, so if possible, we will organize such kind of programs, sir.
Definitely for teachers, we need to conduct a training workshop. Once we train teachers in understanding and experiencing the healthy lifestyle, they can spread this knowledge to all the students. That is very important for us to train teachers. And we'll definitely conduct a workshop. I'm more interested in doing things practically than giving lectures. So whenever we get an opportunity, let us conduct a practical workshop for particularly teachers and also the active yoga teachers and participants. Yeah, that we will do definitely, sir. Thank you, Kishore Garu, for giving me this opportunity.
Thank you, sir. I think Bhagya madam something she want to say.
Sir, one question.
Yes.
Those who are suffering with spina bifida.
Spina bifida, yeah.
Yeah. So is there any treatment for that?
Yes, yes. Definitely there is therapy for spina bifida. We can reduce the suffering, and we can, we may not join the bifurcated spinal cord, but definitely we can solve the problem without any allopathic painkillers and other things. Yes, there is therapy for spina bifida. Yes.
Thank you, sir. Thank you once again. So we'll meet in next whatever possible in that program. What is this, in workshop and other program. Thank you, sir.
Namaste.
Yeah, one announcement for participants.
Dear participants, before breaking for the lunch, all the paper presenters who are there in this platform, you are requested to be ready by 3:30.
Yeah.
To present your papers. Thank you.
Now session will end. So again, we'll come back at a sharp 2 o'clock. Thank you. Thank you very much. Because in the afternoon session also, there is a highly expert person, Dr. Vedapriya Garu, joining from Patanjali Research Center, Haridwar. So beautiful session. Please join at the right time and motivate all the students and teacher educators. Thank you.